Good morning.
How are you?
How are you?
Good.
Good.
Are you well?
Yeah,
Good.
not bad. Yeah.
Good. Good.
Great. How are you? Well, thank you. How are you?
Yeah, we're gonna.
I know. Because I haven't picked any other cookie.
Sound quality. Before connecting, make sure your computer has the latest version of Zoom installed. For the interpretation to work well, it is important that you listen to the same language in which you will speak when you take the floor. For example, if you intend to speak in English during your intervention, make sure you are also connected to the English language channel in Zoom. Send any written notes you have in advance. This will help the interpretation service to prepare for your intervention. And always make sure you speak clearly and at a natural pace so that the interpreters can give an accurate interpretation of your statement in the other languages. Avoid using the built-in microphone of your computer. A good headset will provide the best quality sound for other participants and interpreters. Limit any disturbing elements in your environment, and remember to close doors and windows before speaking, to keep out any background noise. During your intervention, avoid using a mobile phone or connecting over unstable Wi-Fi. And if you are providing a pre-recorded message, please do not use any text overlays or background music. Should you need any support, you can send an email to gbs-it-support at
Good morning, good afternoon, good evening, honorable ministers, excellencies, and distinguished guests. Let us now take up item 6, Executive Board election. I draw your attention to the following list of 12 members. If elected, these 12 members would provide a balanced distribution of the board as a whole. These members are, in the English alphabetic order, Afghanistan, Belarus, Denmark, France, Japan, Malaysia, Paraguay, Peru, Rwanda, Slovenia, Syria Arab Republic, and Timor-Leste. Is the Assembly prepared, in accordance with the Rule 80 of the Rules of Procedures, to elect these 12 members as proposed? As I see no one wishing to take the floor, I understand that there is no objection. I therefore declare the 12th member elected. This election will be duly recorded in the record of Health Assembly. We shall now proceed with item 7, awards. Excellencies, distinguished delegates, ladies and gentlemen, the 4 prizes we will present today honor individuals and institutions for their outstanding contribution to human health. Please refer to document A74/INF/1, awards, for more information on their work and achievements. I will now give the floor to the Director General, who would like to say a few words. Dr. Tedros, you have the floor.
Thank you. Thank you, Madam President. Health begins well before a patient arrives at a clinic. It begins in the womb, in the home, in the classroom. One of the fundamental principles of public health is that prevention is better than cure. And yet, so often, health systems are geared towards treatment while promoting health and preventing disease are neglected. The 2021 Public Health Prizes and Awards celebrate people and institutions who have taken on some of the biggest challenges across the range of health issues. By taking on these daunting systemic challenges, they have made the impossible possible. Their work includes developing smart health strategies to expand primary health care and community health promotion programs among the poor and other underserved populations, designing national strategies, leading critical research for elder care, and promoting the health of elderly people in remote areas, establishing a national infection control program, and leading a campaign to raise awareness of antimicrobial resistance, investigating the health impacts of nuclear accidents for populations now and in the future, and promoting health and developing community capacity, particularly among vulnerable populations, to reduce the consumption of alcoholic beverages and tobacco. They are an inspiration to all of us. I thank the foundations and institutions who so generously support these awards, and I congratulate each of the laureates for their outstanding contributions to science and service. Each of you are worthy recipients of these prizes. Thank you for your contribution to promoting health, keeping the world safe, and serving the vulnerable. I salute you.
Thank you. It is my pleasure to announce the 2021 Sasakawa Health Prize has been awarded jointly to Dr. Wu Ha of China and Dr. Amil Sahib Almani of Oman. I invite Mr. Yohei Sasakawa, Chairperson of Nippon Foundation and WHO Goodwill Ambassador for Leprosy Elimination, to address the Assembly on behalf of the Sasakawa Health Foundation.
I would like to offer my heartfelt congratulations to Dr. Armani and Dr. Wu for their selection as recipients of the 37th Sasakawa Health Prize, as well as to thank them for their tireless efforts to promote primary health care. The Alma Ata Declaration of 1978 stated that health is a fundamental human right. The promotion of primary health care, or PHC, is crucial to achieving the goal of extending this right to all people everywhere. My late father, Ryoichi Sasakawa, established the Sasakawa Health Prize in 1984 to honor noteworthy activities in the promotion of PHC as an essential means of improving human health. We have continued to award the prize for that purpose every year since then. Dr. Armani established a system for antimicrobial resistance surveillance in Oman, facilitating epidemiological surveys of new infectious diseases. In China, Dr. Wu has helped dramatically improve public health, particularly in remote areas far from major cities, by developing a model for training of and collaboration among family doctors. Their activities are the very embodiment of the principles of PHC. Both of them have contributed significantly to the fight against infectious disease, a problem that humanity has long confronted and must continue to deal with in the future. It is my great honor to present this award to two people whose work I admire so much. I look forward to subsequent achievements by Dr. Armani and Dr. Wu in the ongoing effort to bring better health to humanity. My sincerest gratitude to both of you. Thank you.
Thank you. I now invite Dr. Hu to address the Assembly.
尊敬的世界卫生组织执行委员会
Dear WHO Executive Board, I would like to express my sincere thanks for the Honorable Sasakawa Health Prize 2021. I'm very proud to represent the primary health worker in China. This honor is not only dedicated to me, myself, but also to the primary health organizations in China, for all the workers who have been making health services accessible, fair, and safe to protect people's wellness. During the COVID-19 pandemic, the Chinese government has taken high responsibilities to protect our people, and also took effective, transparent, and open measures to protect our people. This can be achieved thanks to primary health workers. In the future, I will continue to abide by the declaration of Alma-Ata and spare no efforts to push the primary health care further and make it fair and accessible. As my course to the public, I will donate all the rewarded $20,000 to the Haokang Foundation in Beijing to build up a seed fund for rural health development in the remote areas of Western China, so as to better develop the Chinese primary health care. We would like to express our heartfelt thanks to Executive Board's support.
Thank you, Dr. Wu. I now invite Dr. Almani to address the Assembly.
I'm extremely pleased and honored to be awarded this prestigious Global Health Prize. It reflects the success of teamwork and support from leadership more than personal achievement. Today, with this award, I am representing all my colleagues in the field of infection prevention and control, who especially during this extraordinary global emergency crisis with the COVID-19 pandemic had extended their roles beyond the healthcare facilities to be an important part of One Health response. The field of prevention had always been the enemy of its success. I don't exaggerate saying it is the fundamental block in the safety of any healthcare system. I take this opportunity to call for prioritizing the investment and innovation in the infection prevention and control tools so we can minimize human factors' impact and prevent future health crises. My thanks and appreciation for the Sasakawa Health Foundation sponsoring this Global Health Prize, and best wishes for the speed global recovery from the pandemic, and the best reward from this experience in building a stronger future global health security system. Thank you.
Thank you, Dr. Almani. It is my pleasure to announce that the 2021 His Highness Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah Prize for Research in Healthcare for Elderly and in Health Promotion of the State of Kuwait Health Promotion Foundation has been awarded to the National Center for Gerontology of China. I invite Dr. Al-Sabah, Minister of Health of Kuwait, to address the Assembly on behalf of the State of Kuwait Health Promotion Foundation.
معالي رئيس جمعية الصحة العالمية الرابعة والسبعين أصحاب المعالي.
Ladies and gentlemen, dear ministers, dear ladies and gentlemen, Vice Ministers for Health, ladies and gentlemen, heads of government, dear Director General of the World Health Organization, ladies and gentlemen, Your Excellencies, good morning to all. For me, it is a great honor and a great pleasure to be able to address myself to you during the World Health Assembly in 2021 for the awards ceremony for this award ceremony for that is being awarded to the National Center for Gerontology of China. It is a prize, the prize of His Highness Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah Prize for Research in Healthcare for the Elderly and in Health Promotion. Now, this award reflects the fruitful cooperation that exists between the WHO and the state of Kuwait. We are very pleased to be able to continue with this fruitful cooperation, and that goes back to more than 6 decades of working together. From the very beginning, the state of Kuwait, since its work with the WHO and since it became a member state at the WHO in the 1960s, we have always cooperated very closely. Today, this is a prize, the prize of His Highness Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah. This prize has as an objective the improvement of the elderly. And for us, we would like to guarantee their fundamental human rights for them to live well in good health and for them to be spared debilitating diseases. This is essential, and this is closely linked to the need to make sure that there is health for all. And this is part of the SDGs, and also as a part of the decisions and resolutions and strategies that have been adopted within the World Health Organization. Therefore, this is a great honor to be able to give this award to the National Center for Gerontology of China. This is a distinction that this center deserves because it is working in favor of the promotion and prevention of healthcare problems in China. And this is as part of the National Health Plan in China that has been adopted for the elderly, and this is a prize that reflects all the activities that have been launched very successfully and that are implemented successfully by this National Center for Gerontology. I wish them the utmost success, and I would like to thank all of those that have been participating in the organization of this award ceremony. I would also like to thank all the participants and all the recipients of these prizes. Now, on behalf of His Highness Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah, this is a wonderful opportunity to be able to commend the achievements of this organization under the leadership of its Director General. Today, we are looking at how we can provide more activities, more healthcare services on the basis of certain criteria and on the basis of certain parameters that have to be based on transparency and objectivity. This has been highlighted by this award. And once again, we would like to wish you success for the future. We will work together hand in hand, and hopefully we will be able to achieve these common objectives. May God bless us in this activity, which is full of audacity. We hope that His Highness Sheikh Sabah Al-Ahmad Al-Jaber Al-Sabah will be able to protect us and guide us. We hope to be able to move forward together. Let us hope that God's peace accompanies you on your path, and that we are successful in our work in the future. Thank you.
Thank you, Your Excellency. I now invite Professor Wang, representative of the National Center for Gerontology, to address the Assembly.
Ladies and gentlemen, WHO officers and experts, we thank the awarding of the Sheikh Sabah Al-Ahmad Award to the Chinese National Gerontology Center. This is not only a confirmation, a recognition of our work, it is also very encouraging for us to continue our work for the elderly. On behalf of all the staff of my center, I would like to confirm our continuous efforts in this regard. Thank you.
Thank you, Professor Wang. It is my pleasure to announce that the 2021 Dr. Lee Jong-wook Memorial Prize for Public Health has been awarded to the state institution, the National Research Center for Radiation Medicine of the National Academy of Medical Science of Ukraine. I invite Dr. Cho Mo-jin, President of the Korean Foundation for the International Healthcare, to address the Assembly on behalf of Dr. Lee Jong-wook Memorial Fund.
Honorable President, Your Excellency Director General of WHO, distinguished delegates, ladies and gentlemen, I am Chumujin, President of Korea Foundation for International Healthcare. First, I express my sincere gratitude to healthcare workers around the world for dedicating to overcoming COVID-19 and making a healthier world. It's my privilege to attend the 74th World Health Assembly to present award to winners of Dr. Lee Jong Memorial Prize for Public Health and pay my respect to the former Director General, Dr. Lee Jong-woo. The prize was dispersed by WHO and the Korea government to uphold the legacy of Dr. Lee. Together with the WHO, COPI reviews candidates and decide the prize winners each year. I am pleased to announce that this year, the 13th Dr. Lee Jong-woo Memorial Prize goes to the National Research Center for Radiation Medicine of the National Academy of Medical Science of Ukraine. This center has experience in providing medical care to patients with acute radiation sickness and long-term medical care of patients exposed to high dose of radiation. Over 30 years, it has studied the frequency of malignant neoplasms in main victims of Chernobyl accident. The center has researched the mortality from disease affected by the disaster and make practical and professional effort. The use of radiation has a double-edged sword, bringing both advantages and harm to health. In this regard, it's especially meaningful that the National Research Center for Radiation Medicine received this year's award in recognition of great contributor to the public health. Its achievement is most consistent with the spirit of Dr. Lee Jong-woo. I sincerely hope its effort can be further expanded to the other countries, regions, and the world more widely. On behalf of everyone watching this video message, I extend my words of appreciation and congratulations to the center. We are continuing to work to promote public health all over the world. Thank you.
Thank you, Dr. Mujin. I now invite Professor Dmitry Bazeka, representative of the state institution, the National Research Center for Radiation Medicine of the National Academy of Medical Sciences of Ukraine, to address the Assembly. Can you please unmute your mic, please? Our apologies. I think there's a technical issue, and we'll come back to the recording later. It is now my pleasure to announce that the 2021 Nelson Mandela Award for Health Promotion has been awarded to the Thai Health Promotion Foundation, Thai Health of Thailand.
Indeed.
I invite Dr. Mahizi, Minister of Health of South Africa, to address the Assembly.
Center of the WHO Radiation We conduct training in treatment of radiation injuries and actively participate in the WHO international programs. I also would like to stress that last years we have expanded our mission to work in environmental health.
Excellencies, esteemed guests, and ladies and gentlemen, it is my great honor to salute the Thai Health Promotion Foundation as the most recent laureates of the World Health Organization Nelson Mandela Award for Health Promotion 2021. It is most fitting for Thai Health to receive this recognition as a reflection of the Excellencies, esteemed guests, and ladies and gentlemen, it is my great honor to salute the Thai Health Promotion Foundation as the most recent laureates of the World Health Organization Nelson Mandela Award for Health Promotion 2021. It is most fitting for Thai Health to receive this recognition as a reflection of the global icon, our revered Madiba's assertion that, and I quote, "Health cannot be a question of income, it is a fundamental human right," unquote. Thai Health has made a significant contribution to health promotion by staying true to its core mission of being agents of equality in access to health so that, and I quote, "all people living in Thailand have capacity and live in society and environment conducive to good health," unquote. This organization implements its important work through health promotion in community and occupational settings by supporting initiatives targeted at the vulnerable populations and through strategic multi-sectoral collaborations. Their initiatives have touched millions of lives in Thailand and around the world over 2 decades. These principles adopted by Thai Health resonate profoundly with the ideals of universal health coverage and advance the Sustainable Development Goals at large. We congratulate you for such noble accomplishment and wish you strength and sustainability as we, together as the global community, build resilient healthcare systems to meet future novelties like COVID-19. I thank you and wish you well.
Thank you, Your Excellency. I now invite Dr. Supranda Adul Yanon, representative of Thai Health Promotion Foundation, to address the Assembly.
It is my great honor to accept the Nelson Mandela Award for Health Promotion 2021 on behalf of the Governing Board, the staff, and all partners of the Thai Health Promotion Foundation. We are deeply grateful to the Nelson Mandela Foundation, the World Health Organization, and our nominator, the Ministry of Public Health, Thailand. This award is a tribute to all health promotion efforts taking place around the world every single day. It is also a testament of the health promotion movement in Thailand. For 2 decades, Thai Health has served as a key innovative enabler of sustainable health and well-being, utilizing the funding from the Surcharge Tobacco and Alcohol Excise Tax to strategically support 3,000 to 4,000 projects each year, in collaboration with partners across all sectors of the society. The movement has contributed to the following changes: the introduction of hundreds of pro-health policy and law, the shift of social norms toward a more healthy and inclusive society, the propagation of effective models for innovative health financing and multi-sectoral platform for health promotion, the ability to react quickly to emerging needs, including COVID-19 responses, and the significant improvement of many health outcomes in Thailand. Going forward, Thai Health are still highly motivated and fully committed to strengthen our contributions, innovations, and effectiveness in order to enable sustainable health and well-being for all. Thank you.
Thank you. We'll now go back to Professor Dmitry Bayazekar, representative of the state institution, the National Research Center for Radiation Medicine of the National Academy of Medical Sciences of Ukraine, to address the Assembly.
Esteemed Chairman, esteemed ladies and gentlemen, on behalf of all our staff members and myself, I want to express my sincere gratitude to WHO for awarding our center with Lee Jong-wook Memorial Prize. Our center was created in 1986, 35 years ago, and it was created shortly after the Chernobyl accident, which induced a lot of problems with the healthcare system of Ukraine. The center is a collaborating center of the WHO Radiation Emergency and Preparedness and Assistance Network, and also we conduct training in treatment of radiation injuries and actively participate in the WHO international programs. I also would like to stress that last years we have expanded our mission to work in environmental health and to study non-communicable diseases, as together with cancer and leukemia, non-communicable and non-cancer diseases play a major role as effects of ionizing radiation exposure. I also to thank our staff, our physicians for work to help and to provide the medical control of the construction workers of this new safe confinement that greatly decreases doses of exposure in Chernobyl zone and provides new standards of security in Chernobyl zone. I also want to thank the country office of WHO in Ukraine for their work, for cooperation, for providing their mission to help with the healthcare system in Ukraine. Thank you for your attention.
Thank you. This concludes our consideration of item 7 of our agenda. We shall now move to item 8, report of the main committee. We will consider the first report of the Committee B, which is contained in the document draft A74/58. The report contains one decision entitled Health Condition in the Occupied Palestinian Territory, including East Jerusalem and in the occupied Syrian Golan. Is the Assembly ready to adopt this decision? I see no objection. The decision is adopted, and the first report of the Committee B, therefore, is approved. I understand that China would like to exercise the right to reply, and I would therefore like to give the floor to China. I would kindly request that in delivering the right to reply, delegation be as brief as possible and in an event not to exceed 3 minutes. Distinguished delegates from China, you have the floor.
Thank you, Madam President. The Chinese delegation requests to exercise the right of reply in accordance with Article 57 of the Rules of Procedure of the WHA. The fact that the WHO rejected Taiwan-related proposal at multiple successive sessions fully demonstrates that the One China principle has been widely supported by the international community. China has also expressed our position repeatedly during this assembly. However, a handful of countries disregarded the consensus of all, obstinately made irresponsible remarks, challenging One China principle, gravely violating relevant resolutions of the UN and the WHO, and undermining the global solidarity in fighting the pandemic. China expresses solemn protest and resolute opposition against this. China reiterates that, regarding Taiwan's participation in the activities of international organizations, reasonable arrangements must be made through cross-strait consultations under the One China principle. The authority of the Taiwan region refuses to accept the One China principle. Thus, the political basis for their participation in the WHO no longer exists. Ever since the outbreak of the pandemic, the central government of China has briefed the Taiwan region for multiple times on the pandemic, approved experts from Taiwan region to participate in WHO's technical activities. In Taiwan region, there is an IHR contact point, which constitutes a smooth communication channel and a sound mechanism to the WHO, the IHR contact points of other parties. Therefore, there is no alleged gap in international fight against the pandemic in the Taiwan region. Behind the hype of Taiwan-related issue by some countries in the WHO is their agenda to create two Chinas or one China, one Taiwan in the international arena. They are using this as a pretext to interfere in China's domestic affairs, but their calculations will never succeed. Thank you.
Thank you. This completes our work for today. Committee A and Committee B will now resume their work, and both committees will hold afternoon session from 1400 to 1700 hours. Distinguished delegates wishing to participate in Committee B should please remain on this link. The meeting is adjourned. Thank you.
This way, we will also have the benefit of hearing the prior strategic briefing on preventing sexual exploitation, abuse, and harassment. Ladies and gentlemen, we will start our work this morning with the review and adoption of our second report. You may refer to document A74.
Une réunion d'information stratégique prévue pour aujourd'hui et qui est intitulée « Prévenir l'exploitation et les abus sexuels de la politique à la pratique ». Vous pouvez trouver les détails de connexion dans le journal. Comme annoncé à la clôture de notre réunion hier après-midi et comme cela est reflété dans le journal, les groupes des points de l'ordre du jour suivants ont été transférés à la commission B. Le pilier 1.14, il s'agit de la santé dans le programme de développement durable à l'horizon 2030. Le point 15, personnel de santé. Et le point 16, il s'agit de l'engagement à mettre en œuvre la stratégie mondiale pour la santé de la femme, de l'enfant et de l'adolescent. Pilier 3, sous-point 22.1, déterminants sociaux de la santé, et point 23, plan d'action mondial de l'OMS visant à renforcer le rôle du système de santé dans une riposte nationale multisectorielle à la violence interpersonnelle, en particulier à l'égard des femmes et des filles, à l'égard des enfants.
Committee A. I shall therefore give the floor to reporter Professor Dimitrov, who will read the report in question. Professor Dimitrov, you have the floor.
Thank you, Madam Chair. First report of Committee A, draft. Committee A held its first meeting on 24th of May 2021, chaired by Dr. Adriana Amaria Paraguay. In accordance with Rule 35 of the Rules of Procedure of the World Health Assembly, the committee elected Dr. Zwelini Mkhize, South Africa, and Dr. Ali Muhammad Miftah Al-Zinati, Libya, vice chairs, and Professor Plamen Dimitrov, Bulgaria, rapporteur. Committee A held its 6th and 7th meetings on 27th of May 2021, chaired by Dr. Adriana Amaria, Paraguay. It was decided to recommend to the 74th World Health Assembly the adoption of the attached 3 resolutions and 3 decisions relating to the following agenda items. Pillar 4, more effective and efficient WHO providing better support to countries. Budget matters. Agenda item 11, proposed program budget 2022-2023. 1 resolutions entitled Program Budget 2022-2023. Pillar 1, 1 billion more people benefiting from universal health coverage. Agenda item 13, review of and update on matters considered by the Executive Board. Agenda item 13.2, political declaration of the 3rd high-level meeting of the General Assembly on the prevention and control of non-communicable diseases. 1 decision entitled Follow-up of the political declaration of the 3rd high-level meeting of the General Assembly on the prevention and control of non-communicable diseases. 1 decision entitled The Role of the Global Coordination Mechanism on the prevention and control of non-communicable diseases in WHO's work on multi-stakeholder engagement for the prevention and control of non-communicable diseases. 1 resolutions entitled Reducing the burden of non-communicable diseases through strengthening prevention and control of diabetes. 1 resolution entitled Oral Health. Agenda item 13.9, integrated people-centered eye care, including preventable vision impairment and blindness. 1 decision. Back to you, Madam Chair.
Thank you very much, Professor Dimitrov. I understand the committee is willing to adopt this report as read out. Are there any objections? I see none. The report is adopted. We will now return to the agenda item 13, review of an update on matters considered by the Executive Board under Pillar 1. 1 million more people benefiting from universal health coverage. Sub-items 13.1, global action on patient safety. 13.5, antimicrobial resistance. And 13.8, immunization agenda 2030. The relevant documents are A74/9, A74/9 at 4, A74, slide 10, revision 1, and A74, slide 10, add 4. While considering the associated reports, the Health Assembly is also invited to consider, under item 13.8, the operational elements for AA 2030. Under item 13.1, we will also consider the draft decision contained in EB 148.5. When we suspended discussion yesterday afternoon, there were still a number of member states who had raised their hands. I invite those member states still wishing to take the floor to now raise your hand again. I would now like to give the floor to the moderator to manage the list of speakers. Thank you.
Thank you, Madam Chair. I would like to invite Senegal to take the floor, to be followed by Cambodia. Senegal, the floor is yours.
Madame la Présidente.
Thank you very much, Madam Chair, distinguished delegates. Senegal fully aligns itself with the statement that was made by Burkina Faso on behalf of the African region. Mindful of the role of patient safety in ensuring universal health coverage, and that's why our country continues to actively participate in the initiatives led by the WHO to ensure that these risks are reduced in healthcare. This commitment for patient safety has been manifested in a number of ways in our country. For example, setting up different bodies and focal points in charge of this question, as well as a national program to fight against nosocomial diseases, and as well to ensure the rational use of antibiotics, and as well to ensure that we reduce the number of infections linked to treatment. We thank the WHO and collaborated on the elaboration of the Global Action Plan on Patient Safety for 2021-2030. Now, resistance to antimicrobial resistance, AMR, is a major issue, and if it's not taken care of, it could lead to 4.1 million deaths in Africa by 2050. And that's why we need to make sure that we fight this effectively. That's why we developed a national we made this a national priority, and we've created a national plan of action for multi-sectoral surveillance of AMR 2017-2020, as well as a surveillance program for looking at bacteria sensitivity to antibiotics. Senegal would also encourage that we increase this surveillance for animal health and for the environment, pursuant to the One Health approach of the WHO. To conclude, my delegation welcomes the different efforts that are going on at a global level and specifically in Africa in order to fight AMR, and we note the report of the Director General. I thank you very much for your kind attention.
Thank you, Senegal. I now give the floor to Cambodia, to be followed by the Philippines.
Honorable Chair, Delegate, distinguished, I'm speaking on behalf of the Ministry of Health of Kingdom of Cambodia on the Global Health Action on Patient Safety, Antimicrobial Resistance and Immunization Agenda 2030. Firstly, the patient safety issue have become key area of the COVID-19 response globally. Cambodia fully support to the final draft of the Global Patient Safety Action Plan. Ministry of Health have been working closely with WHO and other health partners in development and implementation of the various national guidance, strategy, and plan. Cambodia is currently developing a new health strategic plan for the next 10 years, 2021 to 2030, which will cover the safety and quality of health service, including patient safety. Secondly, Cambodia has taken a multi-sectoral approach to address AMR in 2019. The first ever multi-sectoral action plan to combat antimicrobial resistance in Cambodia. Cambodia is first country in the region to receive Partner Trust Fund, which was granted for the period of 2021 to 2022. Further, the Ministry of Health implementing antimicrobial stewardship in hospitals while empowering the general public. Furthermore, Cambodia fully support the Immunization Agenda 2030 and support to develop the regional strategic framework for the vaccine preventable disease and immunization in the Western Pacific 2021 to 2030. Ministry of Health has been working closely with WHO to develop National Immunization Strategy 2021-2025, following the National Health Strategic Plan and Regional Strategic Framework. Cambodia is vaccinating the targeted population with the COVID-19 vaccine along the line with Regional Strategic Framework. Vaccine rollout was firstly launched on 10 February 2021, and so far almost 24 of total targeted population in the country has been vaccinated. Last but not least, Cambodia will take effort to expand scope immunization, maximize the benefit of vaccine and immunization program, sustain achieve immunization goal, and further accelerate control and achieve elimination of additional disease. Thank you.
Thank you, Cambodia. I now give the floor to the Philippines, to be followed by Malta.
Thank you, moderator. First, the Philippines reaffirms its commitment to improve patient safety in order to reduce all avoidable harm and risk of harm to all patients and people during their interaction with healthcare systems, whoever they are, wherever they live, by 2030. The Philippines agrees with the decision to adopt the Global Patient Safety Action Plan 2021 to 2030, and to request the Director General to report back on progress in the implementation of the said plan to the 76th WHA in 2023, and thereafter every 2 years until 2031. The Philippines' commitment is concretized by the issuance of the National Policy on Patient Safety in Health Facilities. With the adoption of the Global Action Plan on Patient Safety, the country aims to strengthen its efforts towards improving the overall patient safety of its people. Second, the Philippines continues to support the WHO's Global Action Plan on Antimicrobial Resistance. Through the implementation of the second Philippine National Action Plan and participation in other initiatives on AMR, including GLASS and WPRACS. The current COVID-19 pandemic has taught us to double our efforts in promoting antimicrobial stewardship by working with our partners in both the human and animal health sectors. With support from the WHO, we have rolled out our online courses on AMS for hospitals and will soon start the implementation of AMS for primary care facilities to prevent the worsening of the silent pandemic of AMR, even as we face the current COVID-19 crisis. Finally, the Philippines fully supports the intent of the Immunization Agenda 2030. The country commits to build a strong, sustainable, and resilient national immunization system, guided by the core principles and strategies of the Immunization Agenda 2030. Thank you.
Thank you, Philippines. I now give the floor to Malta, to be followed by Fiji.
Madam President, Director General, Regional Directors, colleagues, Malta's intervention will briefly focus on Agenda Item 13.5 on AMR. Malta also aligns itself with the statement made by Portugal on behalf of the European Union and its member states on this group of agenda items. Malta commends WHO for the ongoing work on AMR and the progress made. The COVID pandemic has further highlighted concerns regarding the growing public health threat of antimicrobial resistance, particularly in view of the significant increase in the use of antimicrobials within hospitals and intensive care settings. The effectiveness of non-pharmaceutical public health interventions such as mask use, hand hygiene, and increased public awareness on transmission of infection has given us a valuable opportunity to educate further and empower our citizens, also in the fight against AMR. Malta welcomes the establishment of the tripartite Plus One Health Global Leaders Group and its important role in keeping AMR high on the global political agenda. Further comprehensive multi-sectoral action and collaboration at all levels is essential to tackle antimicrobial resistance through the One Health approach, learning from the pandemic to address this growing threat. The proper implementation of national action plans by all member states is critical to global AMR control. This could be improved through better accountability and measurement of country progress through the identification and establishment of key performance indicators for reporting. We encourage all WHO member states to join the Global Antimicrobial Resistance and Use Surveillance System, GLAS, for the provision of relevant and comprehensive surveillance. Collaborative work in joint procurement of COVID-19 vaccines by European member states has proven to be an exemplary mechanism, demonstrating that together we can achieve better outcomes. Such advanced purchase agreements, sharing both risks and benefits, could significantly promote R&D in AMR. Finally, the challenge of AMR is complex and requires sustained combined efforts and coordinated action by all stakeholders across human, animal, and environmental sectors globally. To this end, we call on WHO to continue supporting countries in addressing AMR. Thank you, Chair.
Thank you, Malta. I now give the floor to Fiji, to be followed by Botswana.
Thank you, Chairman. We thank the Director General for his report and also applaud the Secretariat and partners for their efforts in implementing Resolution WHA 72.6. We have noted and welcome the continued progress made in many fronts in ensuring that patients remain the driving force for universal health coverage. In view of the report, Fiji recognizes the importance of establishing a global patient safety standard for universal implementation, as well as guidance on proven measures that member states can readily adopt and integrate into their health systems. Therefore, Fiji looks forward to the finalization of the Global Patient Safety Action Plan 2021-2030 to serve as the standard and roadmap for patient safety interventions at all levels of health services. It is equally important that sustainable financing mechanisms are available for small and vulnerable economies, including those in conflict situations, to strengthen their implementation of the plan. Small island economies like Fiji regularly face competing priorities to effectively respond to multiple health threats, such as climate change and disease outbreaks, which often impede our national efforts to strengthen and sustain universal health coverage and patient safety. We believe that the WHO technical package on quality of care would assist us greatly in this regard. We recognize the importance of AMR to Fiji and Pacific Island states and implore WHO to maintain focus on AMR and in particular the implementation of the One Health approach. AMR has implications for the current global pandemic in the area of infection prevention and control and the control of zoonotic diseases. With the support of developing partners such as WHO and the Government of Australia and its research institutions, Fiji is pressing ahead with the AMR initiative and is inviting support for the establishment of an integrated national surveillance system specific to AMR for our animal health sector. With our tropical climate, a number of zoonotic diseases are seasonal, and drastic changes in weather patterns have disturbed the epidemiological pattern of climate-sensitive diseases. We will need further support to investigate and address these issues. In conclusion, we thank WHO and our development partners for their continued efforts and assistance towards improving patient safety, and call on WHO and development partners to continue in this effort to prioritize the patient safety agenda in all member states for the protection of patients and healthcare workers alike. I thank you.
Thank you, Fiji. I now give the floor to Botswana, to be followed by Malaysia.
Thank you, Chair. Botswana aligns with the statement delivered by Burkina Faso on behalf of the WHO Africa member states. The efforts by WHO to coordinate the global One Health approach through the established Antimicrobial Resistance Division and its 2 departments is highly commendable. AMR threatens the achievement of many of the SDGs and the objectives of the 13th General Program of Work 2019-2023. Chairperson, Botswana commends the WHO's commitment to support member states to tackle AMR through improved surveillance, laboratory systems, infection prevention control, water sanitation hygiene, awareness raising, and evidence-based policies and practices. In this view, the global coordination and tripartite partnership on antimicrobial resistance between the WHO, FAO, and OI is important to ensure the global response to antimicrobial resistance. Botswana has a national action plan on AMR, which will be endorsed. Several activities to improve awareness and understanding of AMR through effective communication, education, and training are conducted on an ongoing basis. On Immunization 2030 Agenda, we know the progress made in advancing the implementation of the Immunization Agenda 2030. We welcome the proposed ownership and accountability frameworks, and there are key elements including the use of data for action, tailored scorecards, and consolidation of disease-specific initiatives through the Immunization Agenda 2030. Botswana delivers immunization in an integrated primary healthcare system. Our routine immunization program is fully funded and implemented by the government. We have invested in building a robust, expanded program on immunization that has successfully introduced new vaccines such as rotavirus, pentavalent rubella. Hepatitis V vaccination was started in 1995, while HPV in 2005. As a measure to increase demand for health services, including immunization, the national guidelines for the implementation of integrated community-based health services was launched in 2020 in order to revitalize people-centered primary health care approach. Chairperson, we thank the Secretariat for the report on global action on patient safety. Currently, we are working with the WHO country office to support development of a country roadmap in line with the flagship initiative, A Decade of Patient Safety 2020 to 2030. These strategies will provide Botswana with a roadmap which will contribute to advancement of universal health coverage. Lastly, Chair, we support the adoption of the Global Patient Safety Action Plan 2021 to 2030. I thank you.
Thank you, Botswana. I now give the floor to Malaysia, to be followed by the Republic of Korea.
Thank you, moderator. First of all, Malaysia would like to congratulate WHO for spearheading the initiative in formulating this Global Patient Safety Action Plan 2021 to 2030. We believe that the Global Patient Safety Action Plan is comprehensive and inclusive of essential areas on patient safety through its 7 strategic objectives. This approach is systematic, practical, and has taken into consideration various stages of effort taken by different countries across the globe to reduce patient harm. Following the adoption of resolution on global action on patient safety, Malaysia has produced a national policy entitled Patient Safety Main Agenda in Healthcare Service, which integrates the Global Action Plan into our policy. We are pleased to inform that Malaysia has been implementing some of the indicators mentioned, such as having specific governing body of patient safety, incident reporting and learning system, mandatory training on patient safety for our health officers, and medication safety program. Apart from that, Malaysia reaffirms its support for WHO initiative with regards to combating the increasing prevalence of antimicrobial resistance worldwide. Malaysia commits to uphold the tripartite collaboration on AMR by taking collective action involving multi-sectoral One Health approach to minimize the emergence and spread of AMR. Malaysia has also been sharing the AMR surveillance data via global AMR surveillance system GLASS. Malaysia, as a member of the Ad Hoc Codex Intergovernmental Task Force on AMR via Health Ministry and Department of Veterinary Service, are working closely to address public health concern in reviewing the code of practice to minimize and contain foodborne AMR. Additionally, Malaysia take note on the update on Immunization Agenda 2030, its proposed ownership and accountability framework, as well as the monitoring and evaluation framework, will definitely facilitate our country's initiative to strengthen vaccine preventable disease program and to achieve UHC through active involvement of public, private sector, as well as NGO. We also thank WHO for developing a dedicated website on the Immunization Agenda 2030. We also welcome the technical support from WHO and UNICEF Country Office in facilitating the selection of suitable country indicators for monitoring and evaluating the implementation of Immunization Agenda 2030. Furthermore, having successfully endorsed the regional strategic framework for vaccine preventable disease and immunization in the Western Pacific, Malaysia is committed in implementing strategies proposed to this framework. Continuous support and technical advice from WHO regional and global office will help to ensure smooth implementation of these
I apologize for the interruption. Your allotted time has expired. Thank you.
Right, thank you.
Thank you to you, Malaysia. I now give the floor to the Republic of Korea, to be followed by Ghana.
Thank you, Chair. The Korean government fully agrees with the WHO-led direction of antimicrobial resistance control and vaccination strategy. We would like to thank the Secretariat for continuing efforts in these areas despite the challenges of the ongoing pandemic. Korea has been a leading member of WHO GLASS since 2016 and has provided AMR information to the WHO every year. In April, the third high-level meeting on AMR was co-hosted by Sweden, Korea, and the WHO. This was a meaningful opportunity to discuss technical documents and policies to address AMR problems and strengthen international cooperation. As the chair of the Codex Intergovernmental Task Force on Antimicrobial Resistance, TFAMR, the Korean government is also playing a leading role in the proposed draft revision of Code of Practice to minimize and contain AMR and proposed draft of guidelines on integrated surveillance AMR, the two international standards for the management of foodborne AMR. The Korean government is also ready to work with member states to provide support at the upcoming 8th session of Codex TFAMR in October and the 44th session of the Codex Alimentaries Commission in November to ensure that the codes are revised to incorporate comments from various sectors and that they reflect One Health approach. Domestically, the Korean government is developing antimicrobial prescribing guidelines, advancing the system for monitoring of antimicrobial prescription and consumption, and developing multi-sector One Health AMR response. Also, the second National Action Plan for AMR control will be made this year. Secondly, regarding the immunization agenda, the current pandemic situation is affecting the immunization programs of many member states. The Korean government appreciates that the WHO has provided a dedicated website for important information and strategies for vaccination. Given the shortages and the disparities in vaccine supply across regions, international cooperation for the fair access and equitable distribution of vaccines will be crucial to overcome the global public health crisis. The Korean government will continue to actively participate in AMR control and vaccination strategy framework led by the WHO and maintain close cooperation with all member states. Thank you very much.
Thank you to the Republic of Korea. I now give the floor to Ghana, to be followed by the United States of America.
Thank you. Chairperson, thank you. Ghana supports the statement made by Burkina Faso on behalf of the 47 member states of the African region. On patient safety, we commend the Secretariat for incorporating comments of member states into the Global Patient Safety Action Plan 2021-2030. We further commend the strengthening of monitoring and reporting with a new heading and a revised text. Access to healthcare has improved significantly over the years in Ghana. However, the expansion of access is meaningless unless it is intricately linked to safe provision of services. Ghana joined other nations to observe the World Patient Safety Day in 2020 and will continue to commemorate the day each year in collaboration with relevant stakeholders. Ghana has integrated patient safety into our national quality healthcare strategy. Chairperson, we encourage member states to earmark funding for patient safety and related activities and to facilitate collaboration between ministries of health and other sectors, including water, sanitation, roads, transport, environment, and housing. We also call on member states to integrate WASH and IPC into patient safety activities while leveraging lessons learned from COVID-19 pandemic and to improve health literacy to their populations. On AMR, we commend the Director General on the comprehensive global report on AMR and National Action Plans implementation, as well as the tripartite AMR Multi-Partner Trust Fund and the One Health Global Leaders Group. Ghana recommends that funding to implement national action plans is strategic to see traction on implementation with a dedicated secretariat to coordinate actions. Increase advocacy and in the veterinary and aquaculture sectors through various campaigns beyond World Antibiotic Awareness Week, an increase in the pace of implementation of the policy and national action plans will be pursued. We call on member states to institute AMR champions to facilitate the effective integration of AMR activities across the sectors. We thank you.
Thank you, Ghana. I now give the floor to the United States of America, to be followed by Qatar.
Thank you. The United States aligns with and supports the Joint Immunization Agenda 2030 statement delivered by Canada, and we reiterate our thanks to the Secretary for their work to develop the operational elements of the Immunization Agenda 2030 and its framework for action. Moving forward, we encourage all stakeholders to make IA 2030 operational, including through regional and national strategies to guide and enhance country implementation. It is critical to ensure that current immunization programs to address vaccine-preventable diseases are sustained and strengthened, even with the additional stressors inflicted by the pandemic. To save lives and curb the COVID-19 pandemic, the international community must work together to ensure that global COVID-19 response activities, including COVAX, are quickly and fully funded. The United States looks forward to continuing our work with the international community to facilitate equitable global access to COVID-19 vaccines, principally through the COVAX facility, and to address the severe current constraints on vaccine manufacturing. This is a global health crisis, and the extraordinary circumstances of the COVID-19 pandemic call for extraordinary measures. Therefore, while the U.S. believes strongly in intellectual property protections in service of ending this pandemic, the United States is supporting the waiver of intellectual property protections for COVID-19 vaccines. The global community must also take concerted steps to address the mis- and disinformation surrounding COVID-19 vaccines and public health guidance. We call on WHO and member states to continue efforts to promote confidence and trust in safe and effective COVID-19 vaccines and routine immunizations broadly. On patient safety and antimicrobial resistance, we applaud the global progress made through continuous actions, acknowledging the difficulty in maintaining these efforts during the COVID-19 pandemic. We are encouraged by the collective commitment to keep AMR high on the political agenda, as evidenced by the April 29th UN high-level dialogue on tackling AMR and the call to action on antimicrobial resistance that was presented and accepted by 110 countries. The United States supports the adoption of the Global Patient Safety Action Plan, which is an important framework for implementing patient safety measures at the global, regional, and national levels. We look forward to working with WHO, other member states, and all relevant stakeholders, including the private sector, to implement the action plan. Thank you.
Thank you to the United States of America. I now give the floor to Qatar, to be followed by Kenya.
Madam Chair, Your Excellencies, distinguished delegates, ladies and gentlemen, speaking on behalf of the member states of the Eastern Mediterranean region, I would like to thank the Secretariat for sharing the Global Patient Safety Action Plan and for the iterative process of consulting with member states, patient safety experts, and the public. Resolution WHA 72.6, Global Action on Patient Safety, was a pivotal step that harnessed international understanding of how pressing unsafe care is, and the urgent need for interventions to address it. The Eastern Mediterranean region is not spared from the consequences of unsafe care. The Global Patient Safety Action Plan guiding principles reflect the true essence of safety being based on science and centered around people. The 7 strategic objectives and corresponding strategies are comprehensive, reflecting a practical action framework that can easily be integrated in healthcare planning and delivery. However, more emphasis needs to be put on the key role of infection prevention and control. IPC is not only an initiative to ensure safety, but also a cornerstone that must be embedded into all levels of healthcare systems. At national, institutional, and individual levels as a core competency for all healthcare workers. Health workers' education is essential for patient safety. The COVID-19 pandemic revealed deficiencies in safety education and training that contributed to the burden of unsafe care. The ever-improving technology allowed introducing and expanding simulation techniques and training and helped anticipate areas for improvement. Therefore, promotion of the use of simulation will prepare the future workforce and improve the current knowledge on safety practices. Patient safety is fundamental in delivering quality healthcare. This need is extenuated in fragile, conflict-affected, and vulnerable settings. One particular challenge in low and middle-income countries is the continuous struggle with limited resources and ways to secure the financial resources needed for the delivery of safe care. In this regard, ensuring the availability of basic resources and minimum requirements like access to water, sanitization, and hygiene wash facilities will guarantee a positive impact on patient safety and safety of care. Finally, we support the adoption of the Global Patient Safety Action Plan 2021-2030 and request the Director General to report back on progress in its implementation to the 76th World Health Assembly in 2023, and thereafter every 2 years until 2031. Thank you.
Thank you, Qatar. I now give the floor to Kenya, to be followed by Brazil.
Thank you, Chair. Kenya aligns her statement with that made by Burkina Faso on behalf of the African member states. We take note of the Director General's report and support the adoption of the Global Patient Safety Action Plan 2021-2030. We commend the Secretariat and member states for the remarkable progress on the implementation of Resolution 72.6 at global, regional, national, subnational, and healthcare facility level. The Kenya government is committed to the realization of patient safety goals, and patient and health worker safety is a priority program in the achievement of universal health coverage. Of note is the establishment of a dedicated patient and healthcare workers division within the Ministry of Health, which has active programs for infection prevention and control, antimicrobial resistance, and patient safety. We also have a National Patient Safety Advisory Committee, and work on the development of the National Patient Safety Policy and Action Plan is ongoing. Regarding the implementation of the Global Action Plan on Antimicrobial Resistance, Kenya notes that AMR poses a significant threat to the achievement of health-related SDGs and has prioritized actions to combat AMR through a One Health approach. To this end, the government has set up a National Joint Interagency Committee and a Joint Secretariat with the Ministry of Agriculture, Livestock and Fisheries to coordinate the implementation of the National Policy and Action Plan on the Prevention and Containment of AMR 2017 to 2022. Kenya is also a member of the Global Antimicrobial Resistance and Use Surveillance System, GLASS, and we have an active AMR surveillance system in place countrywide. We appreciate WHO's support for patient safety and AMR activities through the Global Patient Safety Collaborative and the Tripartite Antimicrobial Resistance Multi-Partner Trust Fund initiatives, respectively. We, however, acknowledge challenges affecting the achievement of AMR targets, including the misuse of antibiotics, weak regulatory environment, poor infection prevention and control practices, weak laboratory capacity to detect and report antimicrobial resistant strains, as well as inadequate knowledge and awareness among the public. We therefore join calls for strengthened technical support from WHO for the implementation of the Global Action Plan on AMR by addressing the existing challenges outlined in the Director General's report through a more coordinated One Health approach, enhanced access to diagnostics and antimicrobials, sustained political commitment and government leadership, increased financing, as well as targeted capacity building in AMR. I thank you.
Thank you, Kenya. I now give the floor to Brazil, to be followed by the Democratic People's Republic of Korea.
Thank you, Mr. Chair and Mr. Moderator. With regards to item 13.5, we recall that in 2018, Brazil published its 5-year National Action Plan for Prevention and Control of Antimicrobial Resistance from 2018 to 2022. The plan seeks to promote a broad and coordinated approach to address the causes of antimicrobial resistance in human health, animal health, and the environment. It was motivated by the need to halt the improper use of antibiotics, to increase the quality of medicines, and to improve surveillance and regulation on antimicrobial use. For Brazil, discussions on AMR must be firmly established in scientific studies and risk analysis. They must promote active access to high-quality medicines by decoupling research and development costs from final stage prices. It is also key that the efficacy of antimicrobials, and in particularly antibacterials, be preserved through appropriate administration, prudent use, and sustainable access. Brazil recalls the multisectorial, coordinated, and interlinked nature of the challenges related to AMR. All actions conducted by WHO must recognize the diversity of factors that contribute to AMR and the importance of preserving the mandates and coordinated nature of the work of different intergovernmental organizations. Collaboration on AMR between WHO and other agencies will be as legitimate and successful as it is implemented under their respective mandates and governing bodies. Brazil welcomes the establishment of the One Health Global Leaders Group, which we hope will contribute to the discussions on promoting access to affordable, safe, effective, and quality medicines, expanding R&D, and promoting appropriate use of antimicrobials. With regards to item 13.8, Brazil supports the joint statement made by Canada and the main goal of the Immunization Agenda 2030, which is to ensure universal access to routine immunizations and primary care. The COVID-19 pandemic has disrupted vaccination campaigns in various parts of the world, striking a major blow to the goal of making safe and effective vaccines available to all in a fair and equitable process. Brazil supports greater engagement of the international community in ensuring vaccination coverage and universal access to health. Thank you, Chair.
Thank you, Brazil. I now give the floor to the Democratic People's Republic of Korea, to be followed by Germany.
Thank you, Moderator. Madam Chair, first of all, DPRK supports the regional statement on AMR delivered by the distinguished Ambassador of Bangladesh. Recognizing the importance of AMR control through One Health approach in public health, DPRK will strive to enhance cooperation with all stakeholders and partners, including agriculture, animal health, animal husbandry, and fishery sectors, towards the implementation of National Action Plan on AMR control. Next, DPRK highly appreciates that the current WHA is taking a successful way forward to finalize the operational elements outlined in the Immunization Agenda 2030 in consultation with member states. Immunization and vaccination activities are of great importance in ensuring better health for all and increasing universal health coverage. Giving priority to immunization agenda is an obligation rather than a task of member states, since many challenges still remain unresolved on the way of eradicating various communicable diseases and newly emerging ones, such as influenza and COVID-19 pandemic, currently threatening the health of all humankind. With regard to the proposed framework for monitoring and evaluation in Immunization Agenda 2030, we believe that the impact goals, proposed indicators, and targets have been developed in a realistic and practical way. We suppose that adding extra monitoring indicators in accordance with actual situation of every country will be of great significance, since the immunization activities are taking place in different public health situations. Madam Chair, the DPRK government has maintained high coverage of all vaccines that are included in the National Immunization Program. In particular, political commitment, financial and human resources coverage kept in high, and monitoring and evaluation of the National Immunization Program well established and is gradually improving. In conclusion, the DPRK will contribute to successful implementation of Immunization Agenda 2030, as well as life-saving and health improvement of our people through qualified implementation of our national immunization activities. Thank you.
Thank you to the Democratic People's Republic of Korea. I now give the floor to Germany, to be followed by the Russian Federation.
Thank you. Germany aligns itself with the statement delivered by Portugal on behalf of the European Union and the cross-regional statement delivered by Canada on the immunization agenda. The COVID-19 pandemic demonstrates the importance of making our healthcare systems ever more resilient. Patient safety is a crucial factor in this process. Germany therefore welcomes the WHO Global Patient Safety Action Plan 2021 to 2030 and compliments WHO with this result of a truly consultative process. We strongly support the adoption of the action plan. The plan sets the right direction for the coming decade and provides member states and all stakeholders with a rich and up-to-date toolbox to strengthen the safety of patients. Minimizing critical incidents and building a safety culture are the basis for trust in our healthcare systems and therefore the basis to improve their resilience. Germany is glad to see that the Global Action on Patient Safety, initiated at the Global Ministerial Summit 2017 in Bonn and codified with WHA Resolution 72.6 2 years ago, has become reality. Tackling AMR, which continues to be a growing problem, requires a multifaceted approach at different levels, as set out in the statement made by Portugal for the European Union. Developing, manufacturing, and distributing new antibiotics is an important element. The recently published WHO's annual pipeline report concludes that overall, the clinical pipeline and recently approved antibiotics are insufficient to tackle the challenge of increasing emergence and spread of antimicrobial resistance. We therefore call on countries to support the global fight against AMR. Germany is one of the biggest state donors in the fight against AMR, including the support of initiatives to develop new treatments, such as the Global Antibiotic R&D Partnership GATP. And Germany is pleased to be the largest donor of WHO's work on AMR and to make available an additional amount of €4 million to be allocated to the Tripartite Joint Secretariat on AMR and the Multi-Partner Trust Fund on AMR, which aims at supporting lower middle-income countries to develop and implement One Health AMR national action plans. Finally, we want to thank the UK for putting AMR high on their G7 agenda this year. Thank you, moderator.
Thank you, Germany. I now give the floor to the Russian Federation, to be followed by Sri Lanka.
Distinguished Chairperson, distinguished delegates, the Russian Federation supports the Global Plan of Action on Patient Safety, as well as the draft resolution which has been tabled. Bearing in mind the risks associated with running modern medical facilities, we underscore that it is essential to introduce a quality control mechanism as a mandatory part of legislation on patient safety. The Russian Federation is developing a national strategy to ensure the safety of medical facilities, which is based on the principles of transparency, openness, as well as mutual responsibility of all parties. We are ready to do everything necessary to share experience in order to deepen professional cooperation between countries and to raise interest in socioeconomic aspects of patient safety throughout the world. Doing so will serve to further the objectives set by the WHO. We thank the Director General for his report on antimicrobial resistance, and we are active participants in all international events and contribute to literature. We are also committed to the comprehensive One Health approach. In the Russian Federation, AMR is treated as a biological threat in domestic legislation. To control it, a number of measures are being taken to protect people's health and the environment. For example, there is a 2030 strategy on warning about the spread of AMR, as well as an implementation plan, which have been adopted. We believe that a country's political commitment to the Global Plan of Action of the WHO on AMR, as well as the relevant UN political declaration, are guarantees that these plans will work in every country which adopts them. We welcome the efforts of the WHO Secretariat to develop mechanisms for accountability, monitoring, and evaluation for the implementation of the 2030 Program of Action on Immunization. We thank the Secretariat for developing guidance documents which are relevant for countries, such as the Strategic Framework Program against Measles and Mumps 2021-2030 and the Global Strategy for Surveillance of Vaccine-Preventable Diseases. We are looking forward to reading these documents and using them as a guide when preparing Russian texts. The government of the Russian Federation has adopted a national 2035 strategy for the development of immunoprophylaxis against infectious diseases, and has also adopted a plan for its rollout, which lays out the main principles, goals, and objectives for immunoprophylaxis in Russia, aligned with WHO proposals. Implementing these will help to meet Russia's needs in terms of, first of all, immunological agents, mortality and morbidity reduction from infectious diseases, and then thirdly, will increase popular uptake of vaccines. I thank you very much for your kind attention.
Thank you to the Russian Federation. I now give the floor to Sri Lanka, to be followed by China.
Thank you, Chair. With regards to agenda item 13.1, Sri Lanka highly appreciates the efforts of WHO in ensuring global patient safety, including the development of Global Patient Safety Action Plan 2021 to 2030, which serves as a roadmap and framework for implementing patient safety interventions at all levels of health service. Our contribution to those efforts include providing inputs to the global and regional level patient safety action plans and sharing country experience related to patient safety at global patient safety platforms. The patient safety activities in Sri Lanka are conducted under the National Policy on Healthcare Quality and Safety 2015. Currently, we are in the final stage of revision of the Policy on Healthcare Quality and Safety and development of a strategic plan for 2021 to 2015, considering the country requirement and WHO strategies. Similarly, National Action Plan on Medication Safety is in the final stage of development. Sri Lanka is in the process of strengthening primary healthcare system in the country, thereby ensuring patient safety activities in the primary healthcare settings as in the secondary and tertiary healthcare settings. Key interventions implemented by the country in order to ensure patient safety include implementation of an incident reporting mechanism, surgical safety checklist, infection control activities, and conducting clinical audits. While more developed countries initiated their patient safety programs earlier, countries like ours who developed the program much later have different issues in implementation of the program depending on the country context. Therefore, Sri Lanka proposes to consider the country context in implementation and evaluation of the patient safety program. We look forward for the fulfillment of WHO's goal of achieving maximum possible reduction in avoidable harm due to unsafe healthcare globally, and will extend our fullest cooperation to this regard. I thank you.
Thank you, Sri Lanka. I now give the floor to China, to be followed by the United Kingdom of Great Britain and Northern Ireland. Distinguished delegate of China, please excuse me for the interruption. We are experiencing technical problems with translation. We will return to your comment shortly. In the interim, may I invite the distinguished delegate from the United Kingdom of Great Britain and Northern Ireland to be followed by delegate from Egypt. Over to you, United Kingdom of Great Britain and Northern Ireland. Excuse us for the technical difficulties.
Thank you. The UK surrender and is pleased to see an ambitious strategy putting equity at its heart and echoes the messages from the joint statement delivered by Canada. It's vital the agenda remains adaptable to allow the integration of new vaccines, such as the COVID-19 vaccine. And the delivery of these vaccines globally has emphasized the need for ensuring strong systems are in place so that all countries are protected against the pandemic and other vaccine-preventable diseases. The pandemic has highlighted the importance of vaccines in saving lives, and the UK encourages the continual partnership of all member states to achieve our collective goal of a world where everyone, everywhere, at every age fully benefits from vaccines. Improving immunisation rates remains a priority for the UK domestically, where the government is committed to strengthening our national immunisation programme and increase uptake of vaccines, particularly in underserved groups to reduce health inequalities. Globally, we have pledged £1.65 billion to Gavi over the next 5 years to support its mission to immunise a further 300 million children and save up to 8 billion lives. On AMR, the UK welcomes WHO's ongoing work to address this silent pandemic whilst responding to COVID-19. We welcome the initial work of the AMR Global Leaders Group and the One Health approach of their action plan, while urging the establishment of the Independent Panel on Evidence for Action and the Partnership Platform. WHO's leadership in addressing AMR across levels and sectors is vital, and to fully understand the impact of WHO's work and to course correct where necessary, we call on the Secretariat to commission external monitoring and evaluation to provide objective insight. Finally, patient safety is a global health priority, particularly given the additional strain on health systems due to the pandemic. The UK government is proud to have spearheaded initiatives to reduce the alarmingly high levels of morbidity and mortality associated with unsafe care in health, including leading with Kenya on the relevant resolution adopted by the 72nd World Health Assembly. WHO's action plan will ensure that momentum is maintained to truly tackle this global issue within the wider context of strengthening national health systems. The UK is committed to working with other member states so that we can make progress collectively and individually in the crucial area of eliminating avoidable harm in healthcare. Thank you, Chair.
Thank you to the United Kingdom of Great Britain and Northern Ireland. I now give the floor back to China, to be followed by Egypt. Please accept our apologies again for the technical issues, as the sound was not received by our interpreter. The floor is yours now, China.
Thank you, Mr. Chair and moderator. The Chinese delegation thanks the Secretariat's report, appreciates the organization's positive role in Global Patient Safety Action, AMR, and the immunization program. We noticed that on the 148th session of the Executive Board, the two concerns we put forward have been strengthened in the revised version of the 2021-2030 Global Patient Safety Action Plan. Also, China proposes to strengthen international exchanges and share with member states and stakeholders in a timely manner the strategic objectives and the best practices of specific strategies, strengthen training and technical guidance for low and middle income countries to help them develop patient safety policies and initiatives tailored to their national conditions, and suggest that the organization call on member states to integrate patient safety and health into all relevant national policies instead of health policies only. For AMR, it is a major global public health challenge, highlighted further by the prevalence of emerging infectious diseases such as COVID-19. China suggests providing guidance with best practices, guidelines, and etc. to further guide countries, especially low and middle income countries, on how to set priorities in the context of COVID-19 so as to seize the opportunity to integrate primary health service delivery patterns consistent with the COVID-19 response and achieve One Health. With regard to the 2030 immunization agenda, On the basis of the continued implementation of the existing national immunization program policies, China will comprehensively assess the relevant disease burden and the vaccine safety, effectiveness, production and supply capacity and other factors, and gradually improve the work so that people can access better vaccination services. At the same time, China hopes that the WHO will provide technical and financial support to countries with low vaccination rates and improve access to vaccines and healthcare services. China will continue to take an active part in relevant international exchanges and cooperation. We look forward to working together with all countries to protect the lives and health of people, protect the earth, our common home, and build a community of health for all. Thank you, Chair.
Thank you, China. I now give the floor to Egypt, to be followed by Portugal.
سيدتي رئيسة اللجنة، السيدات والسادة، طابت أوقاتكم.
Chair, ladies and gentlemen, good afternoon. First of all, I would like to express appreciation for the excellent efforts that have been made by the World Health Organization. We also express our support for all efforts towards patient safety and combating antimicrobial resistance. On item 13.8, we would like to note that Egypt is dedicated to combating these issues and is committed to protecting its citizens and residents. It's also set up a national enhanced plan to combat infectious diseases and antimicrobial resistance. Our aim is to improve the health of people in our country and contribute to a healthier, more prosperous world. Egypt has adopted the 2013 plan to combat these diseases, and particularly combating vaccine-preventable diseases. Furthermore, this contributes to equitable distribution of vaccines. It is, of course, difficult to eradicate any disease without the use of an effective vaccination plan. The Immunization Agenda 2030 will contribute to these efforts, particularly through the provision of primary health care services. To achieve universal health coverage, it is necessary to strengthen all elements of health systems, including immunization and other preventive actions, monitoring and surveillance, as well as preparedness for outbreaks and pandemics, as well as ensuring that use of these products is optimized and resources are provided. The 2030 plan is based on strategic goals which will promote equity and distribution. It will help promote preparedness for emergencies and promote research. Updating this plan on the basis of the strategic priorities and converting this into action on the ground requires national dedication and mechanisms for accountability, surveillance and monitoring at the regional, national and international levels. Egypt therefore supports the immunization agenda and all of its elements. Thank you very much.
Thank you, Egypt. I now give the floor to Portugal, to be followed by Bahamas.
Chair, Excellencies, I have the honor to address the 74th World Health Assembly on behalf of Portugal. We are in alignment with the previous statement made by the European Union. Portugal recognizes that antimicrobial resistance is a current public health threat ready to grow even more. This has been proven by the COVID-19 context, in which we detected an increased misuse of antimicrobials and the standstill of many national antimicrobial resistant action plans. We note worryingly the estimated increase in the number of new and more resistant organisms, especially on TB, malaria, and HIV. And the estimation of drug-resistant diseases pressing 24 million people into extreme poverty by 2030 and 10 million deaths each year by 2050. Portugal urges member states to take the opportunity afforded by this pandemic by underscoring the worldwide impact of infectious diseases, especially emerging ones, to incorporate new vocabulary such as infection prevention and control into people's day-to-day life. We must collectively take note of the lessons learned and the recommendations to adapt current surveillance systems to the truly global networks fit for sharing knowledge and react to threats more efficiently. Global surveillance and the rapid testing are essential for detecting diseases outbreaks early and monitoring their developments, as well as identifying mutations early and monitoring their spread. Share. AMR is often the consequence of the human-animal environment interconnection. The so-called epidemiological triad aligned with the misuse of medicines. Portugal advocates for the One Health approach to be widespread in order to minimize the emergency and spread of AMR. To this end, we congratulate WHO for their work on AMR and underscoring the importance of multi-sector commitment for this fight alongside the Food and Agriculture Organization and the World Organization for Animal Health. Portugal urges a worldwide collaboration on building countries' capacity for surveillance, prevention, and control of this public health threat. Thank you very much.
Thank you, Portugal. I now give the floor to Bahamas, to be followed by Indonesia.
Thank you, Chair. The Bahamas thanks the WHO for its ongoing work elevating the importance and urgency of patient rights. We also recognize that policies and legislation are needed to place patient safety as a focal pillar of primary health care and universal health coverage. We have commenced.
The interpreters apologize. The sound quality is too poor to interpret from. We apologize.
Should I start again?
Distinguished delegate of Bahamas, we are experiencing technical problems. May I ask you to begin your statement again?
Thank you, Chair. Thank you, Chair. The Bahamas thanks the WHO for its ongoing work elevating the importance and urgency of patient rights. We also recognize that policies and legislation are needed to place patient safety as a focal pillar of primary health care and universal health coverage. We have commenced multi-stakeholder discussions in that regard and intend to include patient safety as a core element in hospital services. In a COVID-19 environment, we've also had to rethink approaches to family and friends for hospital visits due to potential emotional and psychological impacts. We support the global call action in a decade of patient safety, 2020 to 2030. The Bahamas has seen much gains in the immunization of vulnerable populations to vaccine-preventable diseases over the past 3 decades, with more than 90% of our population vaccinated. Recent challenges with vaccine hesitancy highlights the need for continued vigilance. The global emergence of some diseases considered rare or even eliminated in the Americas means work on vaccine development, advocacy, procurement, and delivery is not completed. We thank the WHO and PAHO for deployment of the electronic immunization registry, an invaluable tool for securing public trust in vaccines. We believe immunization against COVID-19 is key to ending the pandemic and adjustments to the Immunization Agenda 2030 should be considered in that light. The WHO must ensure equitable access to vaccines, as experience from COVID-19 demonstrate lack of equity and access leads to disproportionate care delivery, morbidity, and mortality. Assistance from COVAX facility is welcome, but small economies struggle to access vaccines outside of the COVAX allotments. Lessons learned from COVID vaccine development should be applied to diseases which affect lower income countries which lack capacity for vaccine development and financing. Neglecting tropical diseases and high mortality conditions should also be a priority in the new immunization agenda. The Bahamas strongly supports the implementation of the Immunization Agenda 2030. I thank you, Chair.
Thank you, Bahamas. I now give the floor to Indonesia, to be followed by Thailand.
Thank you, Chair. Indonesia appreciates the Secretariat for preparing the document under this agenda item. Indonesia aligned itself with the joint statement of AMR delivered by Bangladesh on behalf of the share member state and the cross-regional statement on Immunization Agenda 2030 delivered by Canada. Patient safety issues have become a burden in many countries. 7 to 10 out of every 100 hospitalized patients experience healthcare-associated infection and medication error, costing the world $42 billion annually, not including lost wages and foregone productivity. In this regard, Indonesia supports the adoption of Global Patient Safety Action Plan 2021 to 2030. We believe that the implementation of patient safety strategy should be sustainable, guided by cultural and local contexts, and maintain efficient use of resources. Indonesia has put in place a series of policy accreditation and standardization systems, awareness campaign, and a patient empowerment program as part of our commitment to provide safer health service to all. Indonesia also recognizes the importance of implementation of patient safety as a prevention of antimicrobial resistance. We have a national action plan on AMR which advocates for a prudent use of antibiotic and good quality care management for AMR prevention and control. Indonesia has submitted the 2020 to 2021 tripartite AMR country self-assessment survey, which has helped assist the progress in implementing the NAP in accordance to the One Health approach principle. We encourage other member states to do so. Chair, Indonesia recognizes the importance of R&D of new antimicrobial agents, where the progress has been slow, if not dormant. Therefore, we also need to promote investment for AMR research to find new intervention model, diagnostic tools, and alternatives to antibiotics. Furthermore, while the AMR stewardship and surveillance and the promotion of rational use of antibiotics remain our best intervention, prevention measures such as a vaccination should also become a priority. Immunization for vaccination preventable disease remain a key effort to prevent the need for antibiotic for treatment. Nowadays, the world is focused on COVID-19 vaccination program. Nevertheless, we must remember to also continue with polio, measles, and rubella vaccination. In relation to this, Indonesia supports the operationalization of the Immunization Agenda 2030. I thank you.
Thank you, Indonesia. I now give the floor to Thailand, to be followed by Zimbabwe.
Thank you, Chair. Thailand acknowledges DG reports on patient safety, AMR, and Immunization Agenda 2030. Regarding patient safety, Thailand is committed to promoting patient safety in the context of universal health coverage. The COVID pandemic has magnified the significance of 3P safety, especially personnel for achieving patient and people safety. The Global Action Plan on Patient Safety 2021 to 2030 would be a crucial tool for country-level concrete actions. We endorse the adoption of Decision 5 at EB 148 and look forward to its effective implementation worldwide. As for AMR, Thailand aligned ourselves with the regional One Voice of Southeast Asia delivered by Bangladesh. It has been 6 years since the adoption of Global Action Plan on AMR. My delegations take note that WHO report with concern that progress in tackling AMR is uneven across the globe. In animals as food sources, resistant levels are reported to increase in low and medium income countries. So we need a more critical and comprehensive review on the Global Action Plan's progress, which will enable member states not only to understand how the Global Action Plan has been and is being implemented, but also to monitor and evaluate its outputs, outcomes, and impacts. The review will help stakeholders to assess whether their national action plan requires any changes in response to ramifications of COVID. Last, in regard to immunization agenda, Chair, we all foresee that everyone shall equitably and fully benefit from immunization. Thailand urges the WHO to facilitate global engagement in Immunization Agenda 2030 and to support member states to strengthen immunization through primary health care under universal health coverage. This will ensure equitable access to existing and novel vaccines, especially vaccines against pandemic pathogens leading to less morbidity and mortality from vaccine-preventable diseases. Thank you.
Thank you, Thailand. I now give the floor to Zimbabwe, to be followed by Colombia.
Thank you, Chair. Zimbabwe aligns its statement to the one delivered by Burkina Faso on behalf of the WHO Afro region. We also thank the Secretariat for the reports. We welcome the Global Patient Safety Action Plan 2021 to 2030, which we believe will go a long way in addressing gaps in countries. We also believe that safe infrastructure, technologies, and medical devices are crucial elements to ensure patient safety. Mr. Chair, patient safety also requires multi-sectoral collaborations, including the departments in charge of water, to increase the provision of clean water in health facilities in order to improve patient safety at all levels of the health system. In this regard, Zimbabwe has set up a multi-sectoral water, sanitation, and hygiene in healthcare facilities task force chaired by the Ministry of Health and Child Care. In the ongoing COVID-19 pandemic, the task force has conducted wash facility improvement tool assessments and rehabilitated wash facilities in designated COVID-19 isolation and treatment centers. Concerning antimicrobial resistance, Zimbabwe has developed a national action plan which is guiding its work in this area. We have also joined the Global Antimicrobial Resistance Use Surveillance System. The country is also participating in the WHO External Quality Assurance for Antimicrobial Susceptibility Testing. We wish to express our gratitude to the WHO for the training we are receiving, including in the context of COVID-19. AMR continues to be a critical area of concern, and thus we stress the need to ensure the integration of relevant AMR activities such as surveillance and laboratory, antimicrobial consumption and use, IPC and WASH in the COVID-19 response and overall pandemic preparedness efforts. In terms of access to existing and new antimicrobials, it is important for WHO to assist countries to leverage pooled procurement mechanisms for ensuring affordability and enhanced access. It is also important for WHO to provide guidance to countries to increase the capacity for local production and public sector manufacturing, especially in developing countries. Chair, the COVID-19 pandemic has disrupted the provision of essential health services and deeply impacted immunization programs. In Africa, for example, between January and July 2020, the disruption of immunization services caused more than 1 million children to miss their first dose of DPT containing vaccine, while over 864,000 missed their MCV1 doses. This is in comparison with the same time in 2019. As a country, however, we managed to maintain good coverage of about 86% childhood coverage in 2020, and we are currently carrying out integrated and targeted catch-up campaigns for our underperforming districts. I thank you, Chair.
Thank you. Thank you, Zimbabwe. I now give the floor to Colombia, to be followed by India.
Muy buenos días.
Good morning. We welcome the report presented by the Director General on the Immunization Agenda 2030, which offers a strategic framework to tackle the main issues that are associated with immunization when it comes to primary healthcare and universal health coverage during the 2021 to 2030 period. For our country, the Enhanced Immunization Program, which is a national program, is one of the main priority issues that we're focusing as part of our efforts to tackle COVID-19. And this priority is reflected in the enormous economic investment that's been made to strengthen this plan through introducing new vaccines and implementing a national nominal information system. Thanks to these efforts, now we've been able to move forwards with our national COVID-19 vaccine plan, which is currently at Stage 3 out of 5. Currently, over 7 million people have been vaccinated, of which 3 million have received both doses. Nevertheless, the pandemic has shown that we need to continue strengthening our immunization programs beyond the context of COVID-19. Director General, allow me to also note that our country continues to make efforts to reach 95% vaccine coverage, prioritizing high-risk areas and border areas and guaranteeing access to vaccines not only for the Colombian population, but also to the permanent and in-transit migrant population. We note with concern the negative impact that the COVID-19 pandemic has had on routine immunization activities at the global level, and the risk that that means, since it can mean that we can lose ground covered in efforts to try and stop vaccine-preventable diseases. Therefore, the WHO must redouble its efforts to support member states to ensure safe, equitable, rapid access to vaccines and the implementation of national vaccination plans. To conclude, we would also like to thank the WHO for the activities that have been carried out as part of the Vaccines Bring Us Closer Vaccination Week, which aimed to generate public confidence in the usefulness of vaccines, as well as promoting support for immunization in the long term. We highlight the importance of such initiatives, and we encourage the organization to continue with these processes, which undoubtedly will help to strengthen vaccination processes that are being rolled out by all of our different countries. Many thanks.
Thank you, Colombia. I now give the floor to India, to be followed by Austria.
Thank you, Chair. India is committed towards patient safety as an area of paramount concern and action. India recognizes WHO's efforts to chalk out the first draft of Global Patient Safety Action Plan 2130 and has taken a number of steps for patient safety, starting with National Patient Safety Framework developed with the goal to improve patient safety at all levels of healthcare to progress faster towards universal health coverage in coming decade. Furthermore, an oversight mechanism has also been established in the form of National Patient Safety Steering Committee to deal with patient safety issues like personal protection, health worker safety, medication safety, and patient engagement. Given the urgent nature of current crisis, India believes that it is crucial for WHO to provide technical support and rapidly scale up the global patient safety network to ensure sharing of approaches, best practices, and necessary tools amongst key stakeholders. Chair, India is cognizant of the potential threats of antimicrobial resistance and is committed to tackling the issue. Aligned with the Global Action Plan, India's National Action Plan on Antimicrobial Resistance focused on 6 strategic priorities: awareness and understanding, knowledge and evidence, infection prevention and control, optimizing use of antimicrobial, investment, innovation, research and development. All under the higher vision and mission of an integrated One Health approach involving multi-level coordination amongst various sectors in addition to human health sector. India supports the development of guidance and policies at different tiers of healthcare for infection, prevention and control to prevent the spread of AMR and encourage transparent and traceable supply chain logistics for antimicrobial, including prescription auditing. AMR is a priority concern for India, and we believe that One Health approach needs to be seen as a priority area for WHO. India recognizes the significance of Immunization Agenda 2030 and is currently working towards providing protection against 12 deadly vaccine preventable diseases through our universal immunization program. Chair, the country has made consistent effort during COVID-19 pandemic towards addressing the gaps that might emerge in routine immunization, surveillance of vaccine, preventable diseases, and pulse polio immunization. In the light of pandemic, India believes that the member states should focus on using this opportunity to build cold chain mechanism and digital vaccine tracking and monitoring system to streamline the vaccine logistics supply. With this COVID-19 vaccine currently available, domestically produced, Covaxin and Covishield, and recently introduced Sputnik V5, India has administered a total of 200 million doses so far, thus making greater progress toward Immunization Agenda 2030. Thank you.
The interpreters kindly note that poor sound quality impedes effective interpretation.
To be followed by Paraguay.
Thank you, Chair and Moderator. Austria aligns itself with the statement delivered by Portugal on behalf of the European Union and its member states, and also by the statement made by Canada on the immunization program. On the global action on patient safety, very briefly, Austria thanks the Secretariat for the finalized global action plan on patient safety, taking into account member states' views. Patient safety is one of the most important principles for every healthcare system, and the current health crisis demonstrates that very well. In this context, we shall not be tired to underline the importance of vaccinations, especially COVID-19 vaccinations for healthcare workers. WHO has been providing guidance for patient safety solutions for a long time, and Austria is proud to be part of this WHO patient safety community. We are convinced that this crisis, as well as future challenges, can only be dealt with by international and cross-sectoral cooperation. We are convinced that the Global Action Plan has the potential of profoundly strengthening patient safety worldwide. Therefore, Austria fully supports the Global Action Plan, and I yield back to you. Thank you very much.
Thank you, Austria. I now give the floor to Paraguay, to be followed by Chile.
Thank you. This intervention is focused on 13.8 on the agenda. Paraguay welcomes and takes note of the report. We support the document, and we also welcome the indicators contained therein that will help to maintain the progress made in controlling outbreaks and carrying out eradication and elimination of certain diseases. Currently, the main challenge is to maintain vaccine coverage while the COVID-19 pandemic persists. This is a challenge that must be overcome with a responsible approach involving all different stakeholders beyond the health sector, including decision makers, politicians, communicators, and educators. The aim of this should be to strengthen the messaging on the importance of vaccination not beyond COVID-19. It is also important to keep up our guard when it comes to the risk of resurgence of vaccine-preventable diseases. This requires collective awareness raising. Paraguay has an enhanced immunization program, which involves the indicators mentioned under the immunization agenda. During the past year, the vaccination program in my country was broadened. In 2020, we introduced the second dose of the inactivated polio vaccine for children aged 4 months and the second dose of chickenpox vaccine for those aged 5. In August 2021, we also will carry out a vaccination campaign against measles and poliomyelitis to maintain the country free from measles, rubella, and polio. After addressing gaps in coverage, we now plan to extend the IPV vaccine to those aged 6 months. We have not had cases of measles for over 21 years. Paraguay welcomes the efforts of the WHO and thanks it for the support that it has provided to help vaccine campaigns. And it is necessary to ensure that we can recover the ground lost as a result of the COVID-19 pandemic. Thank you.
Paraguay, to confirm, have you completed your statement? We may be experiencing some technical difficulties. As we confirm, in the interim, I would now give the floor to Chile, to be followed by Japan.
Muchas gracias.
Many thanks, Chair. Chile welcomes the report prepared by the Secretariat and the amendments to the text of the Patient Safety Global Action Plan for 2021 to 2030. Our country also welcomes the Global Action Plan on Antimicrobial Resistance, which it is carrying, for which implementation will be carried out through our national plan. This will soon be approved. In 2016, Chile was a pioneering actor in Latin America, which formed an intersectoral national action plan, which involved cross-ministerial commitments to promote the strategies. The national plan against antimicrobial resistance in Chile also follows the same lines as the global action plan, aiming to make progress on human and animal health, thanks to joint work by various different governmental organizations and in collaboration with academia and the scientific community. With regard to patient safety, our country welcomes Resolution WHA 72.6 of 2019 on global action for patient safety, and has also carried out commemorative actions to celebrate the International Day of Patient Safety. It's also carried out actions within the ministry and has been fine-tuning its policies in the context of the current pandemic. Since 2005, legislation has been adopted in my country to ensure that health providers carry out their task effectively. Currently, 100% of public institutions of healthcare are being evaluated according to a regular accreditation system. Under the context of COVID-19, we have a national plan which has promoted response activities, and this has helped prioritize the health and safety of patients and providers. We've also been reiterating the need to strengthen various different safety principles and protocols. It is necessary to continue working on patient safety to promote opportunities that are available and make the most of those opportunities. Particularly, we think it's necessary to strengthen action to carry out infection control to reduce risk to patients, as well as containing antimicrobial resistance, improving clinical management and health resources, improving occupational health, and as the COVID-19 has demonstrated, preparedness and response for epidemics and pandemics. In the context of the current decade that's being celebrated, we would like to underline the need to keep contributing to actions as part of these efforts. And we would like to conclude by noting that we support Draft Decision 148.5. Thank you very much.
Thank you, Chile. Please note that Paraguay's statement has also been completed. Thank you to Paraguay. I now give the floor to Japan, to be followed by Kiribati.
Thank
Thank you, Chair. Japan thanks the Secretariat to submit the reports on these agenda items to continue discussions. I have 2 points to raise on items 30.5 and 13.8. First, antimicrobial resistance, AMR. Japan sees AMR as an urgent issue that needs to be addressed globally. And we are proud to support global antibiotic research and development partnership in this regard. We hope that WHO, FAO, OIE, and UNEP will strengthen their cooperation to promote One Health approach. Furthermore, we welcome the establishment of Global Leaders Group on AMR to provide advocacy and advisory functions to ensure that action is taken to address the challenge of AMR. Under this circumstance, we request the Secretariat to assess WHO's technical assistance to member states to be grounded on scientific evidence and to be really effective to reduce the threat of AMR. Furthermore, considering that COVID-19 and AMR response can have a synergistic effect, such as hand hygiene and vaccination, WHO should consider a collective action against AMR that is effective and practical in clinical settings and administration in current circumstances during COVID-19 pandemic to promote and support feasible measures to member states. As there has been limited progress in global AMR action plan so far, we wish to hear how WHO is moving forward to further implement it to achieve its objectives during COVID-19 pandemic. Second, Immunization Agenda 2030. Japan aligns itself with a statement delivered by Canada on this agenda item. Japan supports the regional strategic framework for vaccine preventable diseases and immunization in the Western Pacific, endorsed by the Regional Committee last year. To advance existing immunization programs, even under COVID-19 pandemic, we will continue to work with UPRO to support member states' COVID-19 vaccination in line with the regional strategic framework. I thank you. Back to you, Chair.
Thank you to Japan. I now give the floor to Kiribati, to be followed by Bhutan.
Chair, Honourable Ministers of Health, ladies and gentlemen, Kamnapin Naudi and warm Kiribati greetings. It is my honour to have this opportunity to intervene on item 13.8. Kiribati graduated from the Gavi funding support since 2017 and is currently procuring 8 different types of routine vaccinations for our under 5 population. The overall coverage of our under 5 routine vaccination falls between 80 to 90%. And despite the isolation and scattered island geographic challenges, the distribution of qualified and experienced medical assistants and public health nurses to the islands, together with essential equipment and supplies for these health centers and clinics, will ensure that primary health care services are provided, enhancing coverage for immunization for these outer islands. Kiribati works collaboratively with other key development partners to fill in the gaps, to ensure proper planning, coordination, and distribution of vaccines within an enabling environment are well in place. Currently, the COVID-19 vaccines deployment plan is in place, and the first batch of vaccines was officially received from COVAX on the 25th of May, 2021. Kiribati will deploy the first 20% of the Oxford AstraZeneca vaccine to frontliners and high-risk population. The Kiribati government commits to ensure that all of Kiribati population is well covered in its COVID-19 vaccination program. The coordination and planning to procure more doses beyond 20% will be anticipated to go through the WHO pre-qualification process and EUL guidelines. if another alternative vaccine is to be introduced. Integrated and prioritized interventions are focused to ensure ongoing preparations and response plans are in place for COVID-19, and that the ongoing support for essential health services, including reproductive, maternal, neonatal, child, and adolescent health services are not compromised. Partnerships and collaboration will be strengthened to ensure support can be provided to sustain key essential health services. UNIBEST works closely with the WHO and other UN agencies, in particular UNICEF, to ensure technical advice and capacity is streamlined for the procurement, planning, and rollout of routine vaccines within the country. Mr. Chair, I thank you. Ambassador.
Thank you, Kiribati. I now give the floor to Bhutan, to be followed by the United Republic of Tanzania.
Thank you, Madam Chair. Bhutan is aware that most of the global and regional immunization goals set out in the Global Vaccine Action Plan 2011-2020 have not been achieved. The Immunization Agenda 2030 has provided the impetus to continue the world's work in advancing vaccines and immunization. For all member states, translating the strategy into action is critical in reinforcing the unfinished work to meet the unmet aspirations of the Global Vaccine Action Plan 2011-2020. Bhutan considers immunization as a top public health priority, and we have introduced several new vaccines recently into our routine immunization program. With the support from the Government of India, Bhutan has successfully conducted a nationwide COVID-19 vaccination campaign, and more than 94% of all eligible population have been vaccinated in the country. Chair, in the context of the ongoing COVID-19 pandemic, Bhutan applauds the WHO's initiatives in starting the global solidarity trial for vaccines treatment. We are confident that WHO will continue to exert its relevance by playing a critical role to make vaccines available to low-income countries. In particular, we solicit the support of WHO and other partners to address the financial barriers associated for the achievement of full vaccination, particularly in the least developed countries and lower middle income countries. Further, Bhutan extends appreciation to the WHO, Gavi, and CPI for steadfast leadership in initiating the COVAX facility and the Gavi advanced market commitment. We note with appreciation that such activities are geared towards ensuring that the high-risk groups in the most vulnerable nations are the immediate beneficiaries for eventual COVID vaccines, followed by the rest of the population. Lastly, we have noted the operational elements contained in the document titled Implementing the Immunization Agenda 2030, a framework for action through coordinated planning, monitoring and evaluation, ownership and accountability, and communication and advocacy, and hope to work closely with all the players in this field to operationalize the Immunization Agenda 2030. Thank you, Chair.
Thank you, Bhutan. I now give the floor to the United Republic of Tanzania, to be followed by Norway.
Thank you, Chairperson. The United Republic of Tanzania aligns itself with the statement made by us on behalf of the African region on the agenda item 13.1, 13.5, and 13.8. Chairperson, we commend the Secretariat for coming up with a report on antimicrobial resistance. Tanzania is currently implementing the National Action Plan on Antimicrobial Resistance 2017-2022, and since 2017 has been conducting an annual tripartite antimicrobial resistance country assessment survey. Since the launch of the National Action Plan in the 2017, we have been successfully participating in the World Antimicrobial Awareness Week. Awareness creation is achieved through social media, roadmap, shows, training school students, symposiums, and campaigns. Tanzania enrolled in Global Antimicrobial Resistance and Use Surveillance System, in 2019 to strengthen knowledge and evidence-based through surveillance and research. Monitoring consumption of antimicrobials is ongoing. Strategies to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures are in place and are being implemented throughout in the time of the COVID-19 pandemic. Optimizing the use of antimicrobial in human and animal health, Tanzania has established antimicrobial stewardship program. In addition, we have adopted the WHO aware categorization of antibiotics, and we are currently working to strengthen human resource capacity in antimicrobial use and AMR surveillance. Tanzania acknowledges the effort made by WHO Executive Board in coming up with a global action on patient safety for elimination of avoidable harm in the healthcare. As a country, we commit ourselves in adopting and implementing the interventions earmarked in the said action plan to suit our country context. In conclusion, we support the endorsement of the global action for the patient safety, and our country is strategizing on the best ways to track the implementation progress. I thank you.
Thank you to the United Republic of Tanzania. I now give the floor to Norway, to be followed by Australia.
Chair, Norway welcomes the proposed frameworks of the immunization agenda. Operationalization will be challenging, particularly given the COVID-19 pandemic. However, when implementing the COVID-19 vaccination, many countries have established or improved surveillance systems and vaccination registries. This momentum might be an opportunity to further develop and to make use of these systems in other immunization programs. A possible expansion of the COVID vaccination to younger age group will strain the existing resources even further. A strict focus on both existing and future immunization programs is needed in order to secure life-saving vaccines for all children. Vaccines are important in order to prevent infections that normally would be treated with antibiotics. The reduced attention given to the problem of antimicrobial resistance in the context of COVID-19 risks exacerbating the global crisis of AMR even further. The increased number of countries with an implemented national action plan is positive. Norway supports the call for linkages with plans and financing for universal health coverage and primary health care and addressing health security challenges. Norway strongly supports the call for enhanced feedback from health ministries on the process to review the Codex Code of Practice to minimize and contain foodborne antimicrobial resistance. Chair, patient safety culture is the foundation for better patient safety. We appreciate that patient safety culture is implemented as one of the guiding principles in the action plan. Addressing patient safety efforts in work on health worker safety is new but important perspective, as underlined in the COVID-19 pandemic. Norway fully supports and is eager to implement the Global Patient Safety Action Plan, both globally and nationally. Thank you.
Thank you, Norway. I now give the floor to Australia, to be followed by Barbados.
Thank you, Chair and Moderator. Australia thanks the WHO Secretariat for its ongoing critical work on drug resistance and supporting member states to implement their respective antimicrobial resistance national action plans. COVID-19 has clearly disrupted national AMR activities, but AMR continues to be a significant issue with potentially serious health impacts. Australia continues to implement our national AMR strategy for 2020 and beyond, including supporting countries in our region and contributing high-quality data to global surveillance activities. As part of the strategy, Australia's Health Security Initiative is helping countries in the Indo-Pacific region reduce the number of infections acquired in hospitals, clinics, and laboratories. We're also helping countries improve their ability to identify and track AMR across the One Health spectrum and improve diagnosis, prescribing and dispensing practices. Australia encourages countries to implement national action plans and take all opportunities to maximise the fight against AMR and to tackle this critical health issue. Australia encourages members to support the finalisation and adoption of the revised Code of Practice to minimise and contain foodborne antimicrobial resistance and the draft guidelines for integrated monitoring and surveillance of foodborne antimicrobial resistance, being sought by the task force and the Codex Secretariat at the end of this year. In relation to immunisation, Australia is pleased to have joined the Statement on Immunisation delivered by Canada. Australia congratulates the WHO on the launch of the Immunisation Agenda 2030 and appreciates the Secretariat's work to develop and implement a coordinated approach to immunisation aligned across global, regional and country level strategies. Strong governance, monitoring and evaluation mechanisms that promote alignment, transparency and accountability will be crucial in the success of the Immunisation Agenda 2030. We appreciate the inclusion of cold chain storage and supply mechanisms in the agenda targets and strategic priorities, and given the centrality of this to COVID-19 vaccination, appreciates further information on how WHO will support the operationalisation. Australia supports the agenda's attention to vaccination communication strategies tailored to target populations to quickly combat vaccine hesitancy and disinformation. This is increasingly important as COVID-19 rolls out. Thank you, Chair.
Thank you, Australia. I now give the floor to Barbados, to be followed by the Dominican Republic.
Thank you. Thank you, General, distinguished colleagues. Barbados supports the Global Trust to Reduce Antimicrobial Resistance, a national action plan to combat antimicrobial resistance incorporating the objectives of the global plan was completed in early 2017. This is being overseen by a multi-sectoral steering committee and implemented in a stepwise fashion with technical support from the Pan American Health Organization. Improvements of infection prevention and control in healthcare facilities was first addressed with the performance of health facility audit in 2018 and a limited outbreak of COVID-19 in a few healthcare facilities have provided opportunities to enhance the implementation of a robust infection prevention and control measures. Although a functioning antibiotic stewardship program exists only in our public tertiary healthcare institutions, the Queen Elizabeth Hospital, an assessment of community antibiotic use and community health facility antibiotic stewardship continues to receive priority. Barbados is honored to serve until 2023 as one of the founding co-chairs of the One Health Global Leaders Group to advocate for changes in systems of food production, vaccine, and antimicrobial development. Our Prime Minister, the Honorable Mia Amor Motley, has urged that antimicrobial resistance control strategies be incorporated in our national disaster plans. We note the Director General's report and commit to the full implementation of our national plan to combat AMR and pledge support to the process of reform of the Codex Code of Practice to minimize foodborne antimicrobial resistance. I thank you so much.
Thank you, Barbados. I now give the floor to the Dominican Republic, to be followed by Azerbaijan.
Muchas gracias. Thank you, Moderator. Excellency, Chair, Excellencies, distinguished delegates. The Dominican Republic welcomes the Immunization Agenda 2030 as set forth by Canada. We also welcome the content of the report of the Director General and welcome the contributions of the Secretariat in terms of developing the operational elements as described in the proposed framework for action. As a member state, we recognise the need to ensure equitable access to vaccines to guarantee immunisation against vaccine-preventable diseases as part of national immunisation programmes. Therefore, it's necessary to ensure full doses of vaccine for all age groups as a crucial way to maximise the impact of national immunisation programmes over the next 10 years. To achieve maximum impact, it is crucial to have support from the international community, which will need to make the necessary investments in logistics, infrastructure, manufacturing, and supply chains for vaccines. Therefore, we call for sustainable commitments to be made as part of the implementation of the immunisation agenda, and we urge countries to update their immunisation plans to ensure they're aligned with the agenda. Public-private partnerships play a key role in supporting immunisation initiatives among populations within countries. We consider that governments must pool their resources and work together with the pharmaceutical industry and scientific community to promote research and development of vaccines and strengthen alliances with donors whose contributions are critical when it comes to achieving 90% immunisation coverage, given that vaccines save lives. The COVID-19 pandemic has shown once more how important it is to strengthen immunisation strategies in all of these different fields. Therefore, we reiterate that as part of our COVID-19 response, we have been working hard over the past 3 months to provide 35% vaccine coverage. We reiterate our support for the agenda and the commitments contained therein. And we also call on countries to carry out all the efforts that they can to ensure implementation of this, prioritizing COVID-19 immunization. And we therefore also reiterate that we need the support of the international community to guarantee rapid, equitable access to vaccines, which will help us to meet national immunization objectives without neglecting the standard vaccination programs and primary healthcare services. Thank you.
Thank you to the Dominican Republic. I now give the floor to Azerbaijan. After this intervention, I will pass the floor back to Madam Chair.
Ladies and gentlemen, distinguished colleagues, antimicrobial resistance is a growing global threat to public health. The conclusions of the review on AMR in Central Asia and Eastern Europe has given us the opportunity to lay down a systematic review of different data and to understand. We have 3 different labs testing in Azerbaijan, and they carry out quality control in line with the different provisions of the WHO. We have an international working group that is working on AMR, and there are participants from the public health as well as environmental and animal health representatives. This group also participates in the WHO initiative on a number of other issues. Currently, the countries are working on the strategic plan, which is currently being adopted. In the program and the plan of action for immunization, which was up to 2030, we would note that in our country, the immunization campaign has a national calendar, and it's being rolled out according to that as part of our national strategy on immunization against COVID-19. We are carrying out this vaccine campaign nationally, and currently we have a number of people who have been vaccinated against COVID-19, and we're continuing to ensure that we'll be able to cover the entire country. We thank the Secretariat for the report, and we also support this draft decision. I thank you very much for your kind attention on this subject.
Thank you, Azerbaijan. Thank you, Member States. Esteemed Chair, the floor is yours.
Thank you, everyone. It is now to break and close this meeting. We will therefore suspend the discussion on item 13, review and update on matters considered by the Executive Board, sub-items 13.1, 13.5, and 13.8, to be resumed when we reopen this afternoon. But before we close, I will ask the moderator to read out the list of member states with their hands raised. Please note that you will need to raise your hand again when we reconvene this afternoon.
Thank you, esteemed Chair. It's Iraq, Angola, Spain, Islamic Republic of Iran, Madagascar, Ecuador, France, Syrian Arab Republic, Sudan, Uruguay, and Tonga.
Thank you very much. I would also like to remind delegates about the strategic briefing taking place today at 13:10, entitled Preventing Sexual Exploitation and Abuse, From Policy to Practice. Thank you very much. This meeting is now closed.
It's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives.
Le cauchemar de tout docteur, c'est de tuer son patient. La maladie du sommeil, ça fait peur. Parce que la maladie du sommeil, vous voyez ces signes d'agressivité. Vous avez les signes de quelqu'un qui devient fou. La maladie du sommeil ou la trypanosomiase humaine africaine, c'est une maladie infectieuse parasitaire parce qu'elle est transmise par la mouche tsetse.
The fly injects a parasite that circulates, goes into the blood, the lymph nodes, and later on will go in the central nervous system. And then eventually, if they don't have treatment, they will fall into a coma and die.
The last decades of the 20th century have been very productive in terms of new treatment, but nothing happened for those very neglected populations. Personally, when I was working with MSF during the 80s, 90s, I was confronted to a situation that was particularly dramatic because the only treatment available to treat sleeping sickness was melarsoprol, an arsenic derivative, killing 1 out of 20 of patients because of toxicity.
It was described by patients as fire in the veins.
Dans mes prières, j'ai dit, Dieu, est-ce qu'il n'y a pas moyen d'éclairer ces chercheurs pour qu'ils trouvent un médicament facile à prendre pour soigner ces gens qui meurent, ne fût-ce qu'un comprimé.
The first step has been to improve the situation with a combination of nifurtimox and nifurtimox called NECT.
So this is NECT, and all this is for one patient.
Le NECT, c'est un bon médicament, et très efficace, et qui guérit plus facilement. Mais c'est la logistique qui est lourde, parce que c'est fait, il faut transporter ces cartons et l'amener dans le milieu où il y a des malades. Souvent, ils sont dans des forêts, ils sont dans des villages.
This treatment is available only for the second stage of the disease, so you need to go through a very difficult and painful lumbar puncture that every patient needs to be confronted with.
Ceux qui viennent à l'hôpital, on est obligé de les garder parce qu'on doit contrôler la perfusion. Ça doit se donner en intraveineuse.
And the consequence is we wanted to have an oral treatment to treat all the stages of the disease. So we started our research on this field with a basis that one class of drugs, nitronamidazole, was having an effect on this sort of parasite. So we have organized a data mining of all the different compounds of nitronamidazole coming from university, coming from pharmaceutical company. One presented the characteristic of what we were looking for, a molecule that was called fexinidazole, and it was developed during the 80s and abandoned because of lack of interest of developing a product for parasitology.
Sanofi had the molecule, but we partnered with DNDi, who brought their experience from preclinical research and being able to do the clinical trials in these very difficult to reach areas.
We started the study in 2012 in DRC and Central African Republic. It was incredible to have to think about how you would do sophisticated clinical research in an unsophisticated setting.
La RDC est un grand pays et la logistique, elle est lourde.
There was poor infrastructure, lack of scientific lab equipment, no one trained on doing clinical research, and the political instability in these regions. To overcome these challenges, we had to bring electricity. We had to bring microscopes. We also brought some technology like internet and satellites to make sure we would have the connection. We did training of 200 people in good clinical practice, in pharmacovigilance, to make sure that they could comply with what is needed to have a new drug registered according to international standards. We supported the national programs with cars, with boats, to go and look for patients. We work with the best teams, those that know how to diagnose these patients, those that are treating these patients.
Abanye oyo kasoni.
Good afternoon. You will now return to our debate on Agenda Item 13, Review of an Update on Matters Considered by the Executive Board under Pillar 1. 1 billion more people benefiting from universal health coverage, and its sub-items 13.1, 13.5, and 13.8. At the break, the moderator read out the list of member states who wish to take the floor. I now invite those member states to please raise their hands again to indicate that they still wish to take the floor. I would now like to give the floor to the moderator to manage the list of speakers.
Thank you, esteemed Chair. I would like to invite Iraq to take the floor, to be followed by Spain. Iraq, the floor is yours.
شكرا جزيلا سيادة الرئيس. يتقدم العراق بشكره الجزيل إلى منظمة الصحة العالمية في إعداد هذا التقرير. تؤيد وزارة الصحة العراقية آلية العمل بمقاومة مضادات الميكروبات لمنظمة الصحة العالمية.
We are in favor of the AMR, and obviously we're adopting the GPA to fight against AMR. This is an intersectoral plan that covers animal health issues, and also food safety within the framework of One Health. We've adopted a national plan covering 14 points to implement the global strategy against AMR, and includes various activities in various sectors, and this to strengthen information exchange and the rational use of AMRs with monitoring protocols with regard to the use and the application of primary, secondary, and so forth health plans. The Ministry of Health of Iraq has put in place a strategy to fight against the negative effects of AMR, and they include a committee of decision makers from various sectors, including the Health Ministry. Iraq is one of the countries that is fighting for the implementation of the mechanisms put forth by the WHO.
Thank you to Iraq. I now give the floor to Spain, to be followed by the Syrian Arab Republic.
Señor President.
Thank you, Chair. Spain supports the statement made by the European Union and its member states. Our country supports the Global Action Plan for Patient Safety 2021-2030 because we believe that this is necessary to promote awareness of a very important problem for public health, patient safety. Spain has been showing clear commitment to this issue. Our national strategy follows the recommendations issued by the WHO and has helped us to move forward in implementing the commitments undertaken at the 72nd World Health Assembly. We have celebrated the World Patient Safety Day, and we've carried out a number of other measures in the context of the Medicines Without Damage program. We hope that patient safety will remain at the forefront of the health agenda. On the immunization agenda, we thank the Secretariat for the report on updating of the plan, and we hope that we can all pursue our goal of ensuring that everybody, everywhere, at all ages, can benefit from vaccines to ensure the well-being of our populations. At national level, we have a vaccination immunization calendar throughout the life course, even before birth. This begins right through until adulthood. And all of our immunization campaign includes free of charge vaccines. With regard to COVID-19 immunization, we have been drawing up a vaccination strategy on the basis of consensus, and we have now set the very solid scientific base to use all of the relevant scientific knowledge available. We have been vaccinating the most vulnerable, first of all, those who are most at risk of the pandemic, and we also have a strategy for sharing COVID vaccines with the rest of the world. We hope that there can be universal access to these vaccines so that we can vaccinate as many people as possible around the world. We are promoting a vaccines for all strategy so that we can share knowledge, step up production, and accelerate these rolling out of vaccination campaigns in the context of SETUP and COVAX. For as long as we haven't vaccinated all over the world, we won't all be safe. So, to sum up, in Spain, we're very committed to equitable access to immunization campaigns, particularly in the light of COVID-19. And we'll continue to work to ensure that the objectives of the 2030 immunization agenda can be met.
Thank you, Spain. I now give the floor to the Syrian Arab Republic, to be followed by Angola.
مساء الخير. نشكر لكم إتاحة الفرصة للالتزام للتدريب.
Good afternoon. Many thanks for giving us the floor on the item on vaccinations. We're well aware that vaccination has been a success throughout the world. It allows us to save thousands of lives. It has also allowed us to say that it's a foundation of the health systems of many countries throughout the world. In our country, we have a vaccination program, and this allows us to fight against epidemics and infectious diseases. In Syria, we have a national program that dates back to 1968 in various provinces, and we've been able to cover the entire country, all of our provinces in 1980. Unfortunately, in 2014, the Civil War began, and since then we've had more difficulty following up with this plan. Yet we have a plan to vaccinate children, especially those children of age of 5 to 12. We're not able to receive vaccinations because of the war, and this covers obviously tetanus shots. And these vaccines are, of course, free to all citizens of Syria, regardless of their economic situation and so on and so forth. This program has been followed up with success, thankfully, and we've been able to reduce the number of diseases and, of course, increase the confidence amongst the population. Our coverage has dropped to 60 to 70% now, as before the war it was around 80%. We hope to be able to get back to the coverage levels we had prior to the war via our efforts, and we know but this is difficult considering that many of our hospitalization centers were destroyed. Now we are working with international teams to improve the situation, and we really appreciate the efforts they made and the assistance we've received. In 2020, 2021, we were able to put in place a pluriannual program, and we've strengthened our vaccination program to ensure vaccination against poliomyelitis and rubella. As far as our action plan also takes into account the global strategy on vaccinations and also Gavi's programs. We're trying to focus on children who've had 0 doses, and we're also trying to deal with the COVID pandemic. Obviously, we reaffirm the importance of the national strategy of vaccination in our country, and we aim to ensure all receive vaccinations, and we hope that the multilateral efforts will continue.
Thank you. I now invite Angola to take the floor, to be followed by Ecuador.
Merci beaucoup.
Yes, thank you, Madam Chair. We align ourselves with the declaration made by Burkina Faso on behalf of the African region. Angola is putting in place a new strategy to improve vaccination through the running up to 2030. We recognize the importance of vaccination in preventing disease. Improving health means dealing with epidemics that are rampant throughout the world. Vaccination is an element, a key element of this effort. And also is the basis, one of the keys to universal health care. Vaccines should be considered as a public health good and be available to all. COVID-19 is a perfect example of the need to develop new technologies to develop vaccines. This will allow us to move forward to also deal with neglected tropical diseases like malaria, dengue, tuberculosis as well, and perhaps even AIDS could be dealt with these new technologies. It's possible that COVID-19 is not the last pandemic we'll see. We necessarily have to keep our guard up and work to make sure the vaccines are available to all. Thank you, Madam Chair.
Thank you, Angola. I now have the privilege of giving the floor to Ecuador, to be followed by the Islamic Republic of Iran.
Gracias, señor Presidente. Thank you very much, Chairman. Ecuador is grateful to the Secretariat's work and for the commitment of states to the Immunization Agenda 2030. We believe that it's very important to ensure that the immunization agenda is based on regional and national strategies so that we can have mechanisms for accountability and implementation. We also need monitoring and evaluation to guide implementation in our countries. We have decided to strengthen our immunization campaigns, focusing on the most vulnerable groups to vaccine-preventable diseases, and we hope to achieve 90% vaccination coverage. We are, however, facing a number of challenges. This is a devastating pandemic, which has meant that we've had to reallocate resources to be dealing with the COVID-19. And this means in immunization campaigns and in dealing with patients, we have the same staff dealing with surveillance and indeed the administration of vaccines. Of course, it's very urgent to immunize, to vaccinate against COVID-19 as quickly as possible from a health perspective, but also to ensure economic recovery. So we need to bear in mind our immunization targets, because if we fall short of some of those targets, this may give rise to even greater health challenges in the future, and this will also mean social economic challenges for our countries. In this context, we'd like to underscore the importance of strengthening real cooperative links in order to combat the current pandemic and reiterate our commitment to the Immunization Agenda 2030. Thank you.
Thank you, Ecuador. I now give the floor to the Islamic Republic of Iran, to be followed by Sudan.
Iran Interaction on Global Action on Patient Safety. Mr. Chairman, distinguished colleagues, allow me to appreciate WHO for considering patient safety in the agenda of the 74th session of the WHO. Our intervention related to the patient safety can be categorized into three phases, including readiness, empathy, and stabilization. The intervention were according to the PSFHI, which has been provided by the EMBRO. The most important action taken in the first phase based on SO1-6 are as below. Develop comprehensive national patient safety action plan, introduction, root cause analysis, and proactive risk management to the hospital, determine LASA and high alert medication, limitation of the production of the local drug. Medication reconciliation is done by clinical pharmacists, setting up the surveillance of the Healthcare Association infection and its reporting system. Standard precaution and isolated are applied by healthcare worker. Translation of the patient safety curriculum guide, educating healthcare worker about the general concept related to the patient safety, risk management, patient safety culture, various tools and methods for improving patient safety, holding in service training of healthcare worker about the patient safety. The system of self-reporting of the patient safety adverse event was launched under the supervision of the Center of the Monitoring of Accreditation of Medical Affairs. At the end, while we are fully agreeing with the content of the document EB 148, January 2021, but the following 2 points are noteworthy. It is emphasized that countries publish and provide information in accordance with their domestic law and regulations. 2, considering that the measure taken in the field of the patient safety, we believe that gaining experience in extending and establishing patient safety standards in the inpatient section will facilitate the deployment process in other hand care setting, including the outpatient section. Considering the start of the program in the country in 2010, there has been 3 stages for its formation in the country as follows: familiarization, enforcement, and stabilization of the program. Thank you for your attention.
Thank you to the Islamic Republic of Iran. I now give the floor to Sudan, to be followed by Tonga. Distinguished delegate from Sudan, we are unable to hear your audio. We apologize for any technical difficulties. In the interim, we will begin now with the intervention by Tonga. Tonga, you have the floor.
Honorable Chair, WHO Director General, Dr. Tedros, Your Excellencies, the Kingdom of Tonga wishes to make an intervention for the agenda item 13.5 on antimicrobial resistance. Tonga welcomes the progress made across the globe to fight against AMR depicted in the DG's report. Majority of the countries, including Tonga, has developed a national action plan to counter the threat. Awareness in the general public of this issue has increased remarkably through campaigns, especially through World Antibiotic Awareness Week. However, the effort is not enough to counter the threat of AMR. It is crucial that all countries work together, as Tonga and other small island states are vulnerable and are at the mercy of larger countries' actions. The threat of infectious diseases has never been more palpable with COVID-19 pandemic. It is time to improve and strengthen surveillance, infection prevention and control, water, sanitation and hygiene, as well as rational use of antibiotics. The Ministry of Health in Tonga has identified AMR as one of the priority agenda items following series of infectious disease outbreaks which has overburdened the current healthcare systems. Tonga had started experiencing the threat of AMR as evidence from the lab-based surveillance that MRSA is widely spreading throughout the island groups of Tonga. With support from WHO and guidance through the framework for accelerating actions to fight antimicrobial resistance in the Western Pacific region, Tonga has developed our first national plan, Tonga National Multi-Sectorial Plan on Antimicrobial Resistance 2017 to 2022. Finally, we are currently implementing the plan and look forward for collaboration and support from WHO and other development partners. Mahalo Aupito. Thank you, Honorable Chair.
Thank you, Tonga. There are no further requests for the floor from member states at this time. If they arise, we will invite those member states back to the floor. We will now continue with the list of observers, international organizations, and non-state actors. In accordance with the rules applicable to observers at the World Health Assembly, I have the pleasure to give the floor to the representative of Gavi.
Gavi congratulates member states on the adoption of Immunization Agenda 2030. As we embark on this new vision, we must recommit to vaccine equity not just between countries, but within countries. This will require concerted country action to reduce the number of children who remain deprived of even the most basic vaccines. Sadly, more than 10 million children do not receive a single shot. These zero-dose children are markers of compounded vulnerabilities and severe inequities, embodying communities that face acute poverty, gender barriers, stigmatization, and low access to education, nutrition, water, and sanitation. If we can reach them with immunization, we can surely bring them other essential services through multi-agency, multi-sectoral coalitions. The cost of inaction is clear. Communities with a large number of zero-dose children are more vulnerable to disease outbreaks, medical impoverishment, and deaths. 50% of vaccine-preventable deaths are concentrated among zero-dose children. Gavi thus urges member states to prioritize highly differentiated and targeted subnational strategies to reach zero-dose children and missed communities with the full course of vaccines, but also essential primary health care, so that together we save lives and realize the SDG vision to leave no one behind. I thank you.
Thank you, Gavi. In conformity with Rule 47 of the Rules of Procedures of the World Health Assembly concerning the representatives of the United Nations and of other intergovernmental organizations, I would now like to give the floor to South Center, to be followed by IAEA.
Thank you. And the South Center welcomes the progress report from the Secretariat on AMR and the growing efforts to advance a global One Health approach that addresses health, agriculture, food production, and environmental aspects of antimicrobial resistance. Greater global collaboration is needed. It has been almost 5 years since global leaders at the UN General Assembly adopted the UN Political Declaration on Antimicrobial Resistance, and developing countries require more significant support from WHO to build technical capacity at the country level for an effective response. The mobilization of funding for the implementation of national action plans continues to be slow and endangers the ability of countries to address this global health issue. A key priority for the Global Leaders Group should be to mobilize resources globally. Lessons from COVID-19 have reinforced the importance of building and sustaining robust health systems. In line with the SDGs, critical areas for developing countries to prioritize and where they will need international support is in improving infection prevention and control, including by upgrading infrastructure for clean water and sanitation, hospitals and healthcare centers, as well as strengthening human resources, access to diagnostics, treatments, and vaccines, and laboratory capacity for functional AMR surveillance systems across human, animal, and environmental sectors. Access to antimicrobials continues to be a significant challenge. As such, the WHO should advance mechanisms to ensure affordable access to existing and new antimicrobials that include support for pool procurement, local production, and public sector manufacturing in developing countries. The WHO should also continue to link the challenge of innovation in antimicrobial space with our access, with an end-to-end approach. There is a need to fix the broken system of innovation to deliver antimicrobials as global common goods, with increased public investment and coordination for research and development. The link from price and volumes to ensure adequate stewardship and ensuring access based on need. Thank you.
Thank you, South Center. I now give the floor to IAEA.
We join previous speakers in welcoming the progress in the implementation of the political declaration of the third level meeting of the General Assembly on the prevention and control of NCDs. The IAEA, jointly with WHO and IARC through PACT, streamlined the approach to develop comprehensive cancer control programs for member states. The IAEA's work in radiation medicine supports key global initiatives on cervical cancer, childhood cancer, and the forthcoming breast cancer initiative. Due to great collaboration with our partners, member states can continue receiving this support virtually despite COVID-19. Over the past few months, the IAEA, together with global professional societies in radiation medicine, has provided thousands of health professionals with a wide range of resources, including webinars in multiple languages. In addition, the IAEA published information on how to ensure continuity of essential radiation medicine services during the pandemic. The IAEA also conducted surveys to assess the effect of COVID-19 on access to nuclear medicine studies worldwide. These were found to have significant decreases in availability because of the pandemic. Now, looking ahead to cost-effectively address the varying conditions of radiotherapy in countries, an interactive e-learning platform is being developed. The IAEA has also recently convened the first high-level meeting with global leaders of major radiation oncology societies, research groups, journals, and thought leaders to further develop a unified global database, Orion, and international research database. We look forward to continuing our collaborative work with WHO in support of our member states to build back better, more resilient health systems and to implement the health-related SDGs.
Thank you, IAEA. Several non-state actors in official relations with WHO have requested the floor on this group of items 13.1, 13.5, and 13.8. According to the privileges conferred by the relationship with the World Health Organization, I have the pleasure in giving the floor to the representative of Médecins Sans Frontières International, to be followed by International Pharmaceutical Federation.
Thank you, Chair. MSF faces serious challenges preventing, diagnosing, and treating drug-resistant infections. First, surveillance has proven instrumental in the control of COVID-19. AMR remains a blind spot in many areas. A significant increase in international support to strengthen diagnostic capacity in resource-poor settings is urgently needed to improve stewardship and patient care in real time. Second, substantial public R&D funding for COVID-19 has transformed neglected coronavirus pipelines into ones with hundreds of candidates. Member states should adopt expedited efforts to stimulate AMR R&D similar to those for COVID-19 and commit to expanding sustainable access globally. Third, a leap in technical and financial investment must follow the establishment of the Global Leaders Group to catalyze implementation of national action plans and support global coordination of R&D and sustainable access efforts, including via product development partnerships such as GARP. Lastly, to mitigate shortages and access antibiotics sustainably, solutions must include international pool procurement mechanisms to which countries could subscribe. Thank you for your kind attention.
Thank you, Médecins Sans Frontières International. We now invite Sudan back to the floor. Sudan, the floor is yours. Sudan, we apologize for any technical difficulties. We will return to you as quickly as possible. In the interim, I now pass the floor to International Pharmaceutical Federation. The floor is yours.
Honorable Chair, to drive action on antimicrobial resistance, a few months ago, FIP established the FIP Commission on AMR. The Commission works on supporting the pharmacy profession, for example, by building a repository of resources. We are also planning a broad engagement exercise during the World Antimicrobial Awareness Week through a series of events which will run throughout all 6 WHO regions. Furthermore, we are pleased to read that at least 144 countries have a national action plan on AMR. FIP has called on its national pharmacy associations to take an active role in the development and implementation of these plans. FIP continues to facilitate the essential contributions of pharmacists to AMR reduction around the world,
which include surveillance and monitoring of antimicrobial use and resistance, antibiotics distribution, and regulation. FIP and pharmacies globally are committed to being
I
the part of the
apologize
solution.
for the interruption, our dear colleagues from International Pharmaceutical Federation. Your time has expired. We will now like to invite Sudan back to the floor. The floor is yours.
Thank you. Honorable Chair, Excellencies, distinguished delegates, the COVID-19 pandemic has given prominence to the potential threat of infectious disease and its multifaceted effects on human health and economics, potentially impacting the level of resistance to antimicrobials. Sudan suffers from irrational use of antibiotics, as the current evidence shows high-level resistance for commonly used antibiotics and prevalence of antimicrobial use. Sudan updated the essential medicine list to optimize use of antimicrobial resistance. The country's current financial circumstances has led to scarcity of funding furthering AMR. We are now currently looking to join multi-partner trust fund to fight this growing global health threat. Sudan has recently joined the Call to Action on AMR 2021, which aims to strengthen One Health and multi-sectorial actions to tackle antimicrobial resistance. We encourage member states to also join this commitment to achieve the 2030 Agenda for Sustainable Development. Sudan fervently supports approaches made by the WHO to enhance the implementation of national action plans for combating antimicrobial resistance. We urge for the enforcement of a legalization system that strictly monitors the use of antibiotics in the animal sector and call for the reactivation of a governance structure for AMR in line with One Health approach. Honorable Chair, in regards to patient safety, Sudan retreats its support to the global action on patient safety and salutes the WHO for ongoing commitment and support. With regards to the third global patient safety challenge, medications without harm, Sudan is considering medication safety as a primacy with an aim to reduce medication-related harm through the implementation of a comprehensive medication safety program in selected pilot hospitals, with the future direction to scale up the coverage in effort to improve measurement. Sudan commenced action for establishing baseline measurements of the patient safety culture in Sudanese hospitals using the hospital survey on patient safety. Despite facing several challenges, Sudan highlighted the importance of patient safety during the pandemic through the consideration of patient safety in various committees responsible for prevention, management, and containment COVID-19. In effort to advocate and raise awareness on patient safety and promote better patient safety practices, Sudan celebrated World Patient Safety Day in both 2019-2020, in which awareness campaigns were organized and included mass media. We call on the WHO to provide support in building capacities and strategies to ensure effective implementation of patient safety practices to enhance reporting and learning system and provide assistance in developing a national patient safety action plan. Thank you.
Thank you, Sudan. I now pass the floor back to Tropical Health and Education Trust, to be followed by FDI World Dental Federation. Tropical Health and Education Trust, the floor is yours. In the absence of a response, we will continue with the next non-state actor, FDI World Dental Federation. The floor is yours.
FDI World Dental Federation is concerned by the limited engagement of oral health professionals in AMR efforts, despite dentists prescribing up to 10% of antibiotics. For the Global Action Plan on AMR, we urge member states to recognize the role of dental teams in raising awareness, preventing and controlling oral infections, and antibiotic stewardship. Lack of access to dentistry during COVID-19 lockdowns led to increased antibiotic prescribing. FDI is forming a dental AMR early career research network, asking member states to support such initiatives to better understand variations in use and find solutions. We welcome the strategy for infection and prevention and control to minimize MR under the draft Patient Safety Action Plan. Antibiotic stewardship is also crucial given patients' risk of severe allergy and other infections. We commend the recognition that health worker safety is essential for patient safety and ask member states to include oral health professionals in their actions. On immunization, we ask for the role of dentists in administering vaccines to be considered to support the rollout of immunization programs. Thank you. According to national regulations. Thank you.
Thank you, FDI World Dental Federation. I now pass the floor to the International Alliance of Patients Organizations, to be followed by the United States Pharmacopeal Convention.
Thank you, Chair, Excellencies, distinguished delegates. The COVID-19 pandemic has given prominence to the potential threat of infectious disease and its multifaceted effects on human health and economics, potentially impacting the level of resistance to antimicrobial use and prevalence of antimicrobial resistance. The country's current financial circumstances has led to increased antibiotic
Thank you, Chair. This statement is delivered by IAPO representing patients worldwide and on behalf of 8 non-state actors in official relations with the WHO. We welcome the decision of EB 148 to recommend to the WHO to consider and adopt the Global Patient Safety Action Plan 2130. We also thank the member states in support. In building back better, we must instill a patient safety culture in the design and delivery across the whole healthcare spectrum if we want to have safe, people-centered, accessible, affordable, and high-quality healthcare for all. The implementation of the action plan, however, must engage the patients, their families, and caregivers, and their experiences in co-creating safe care that fosters trust in health systems, health professionals, and medical products. We would like to thank WHO Secretariat and the Patient Safety Flagship Initiative for strongly embedding this dimension into the action plan. On behalf of the entire patient community, we urge the WHA 74 to adopt this resolution. Thank you for your attention.
Thank you to the International Alliance of Patients Organizations. I now pass the floor to the United States Pharmacopeal Convention, to be followed by the International Federation of Medical Students Associations. Hearing no intervention, we will return to that non-state actor and continue now with the International Federation of Medical Students Association.
Honorable Chairperson, distinguished delegates, the International Federation of Medical Student Associations commenced the work of WHO and stakeholders in finalizing Immunization Agenda 2030. We would like to emphasize that young people around the world play important roles in immunization through research, education, professional support, and raising awareness. Therefore, we call upon member states to meaningfully engage the often untapped resource that is youth in the design, implementation, and evaluation of national and local immunization programs, including COVID-19 vaccination. Furthermore, we are currently facing immense threat of inequitable COVID-19 vaccination. To truly leave no one behind and successfully combat this pandemic, we strongly urge member states to collectively ensure equitable distribution of vaccines. Thank you.
Thank you to the International Federation of Medical Students Association. I now pass the floor to the Union for International Cancer Control, to be followed by the World Organization of Family Doctors. Hearing no intervention from the Union for International Cancer Control, we will return to you and continue now with the World Organization of Family Doctors.
Honorable delegates and chairperson, the World Organization of Family Doctors represents more than 500,000 doctors. WONCA members have contributed to the development of the Global Patient Safety Action Plan and are committed to a strong collaboration with WHO. As leaders of primary care teams, family doctors manage health risks to guarantee safe care by implementing safe practices together with their teams and trainees. Family doctors have reinforced their role as community health reference during the pandemic. They build trust in the acceptance of vaccines and are actively taking part in community vaccination with special attention to marginalized populations. We note countries with stronger primary health care can offer a better, safer response to the pandemic. WONCA encourages governments to invest in strong and safe primary care, in support of the health workforce, and in health information systems as the best efficient initiatives to achieve safe universal health coverage and to face future global health risks. Thank you very much for your kind attention.
Thank you to the World Organization of Family Doctors. I now pass the floor to the International Council of Nurses, to be followed by the International Society for Quality in Healthcare Incorporated.
Thank you. Nurses are the largest clinical providers of immunization worldwide. ICN is deeply concerned by the gross inequalities globally in COVID-19 vaccine access. Right now, younger and less vulnerable people are being vaccinated in some countries before healthcare workers and vulnerable populations in other countries. ICN strongly believes that health workers, healthcare students, and vulnerable populations in low and middle income settings must receive the COVID-19 vaccine before younger and less vulnerable people in high income settings. ICN urges relevant member states to act swiftly on the IPPPR recommendation to provide the billions of doses needed in low and middle income countries, and notes that sharing vaccines is both in health and economic interests of countries. We also call on governments to increase the involvement of nurses and nursing organizations in planning, management, implementation, and monitoring of immunization programs at all levels. Vaccine equity and prioritization of vulnerable populations, nurses, and healthcare workers is a fundamental issue of morality, ethics, and human rights. And
I apologize for the interruption. Our distinguished colleagues from International Council of Nurses. I now pass the floor to the International Society for Quality in Healthcare Incorporated, to be followed by the United Nations Foundation Incorporated.
Thank you. Patient safety is a global health priority. Therefore, ISQA is pleased to support the Global Patient Safety Action Plan 2021-2030. ISQA commits to facilitate discussion and debate around policies, strategies, and actions to eliminate all sources of avoidable harm to patients and health workers. ISQA will ensure that the guiding principles and values of the Global Patient Safety Action Plan underpin its work in this decade of patient safety. Through its international network, annual conference, education, and external evaluation programs, ISQA will support the dissemination of knowledge, policies, strategies, and actions based on scientific expertise and patient experience, which reflects both the care setting and collaborative working to eliminate all sources of avoidable harm and risk to patients and health workers. ISQA will also continue to support the National Quality Policy and Strategy Program to enable member states to develop strategies for safe, person-centered, high-quality care.
I apologize for the interruption. Thank you to our dear colleague from the International Society for Quality in Healthcare Incorporated. I now pass the floor to the United Nations Foundation Incorporated, to be followed by the Task Force for Global Health Incorporated.
Thank you, moderator. Honorable Chair, distinguished delegates, the United Nations Foundation welcomes progress made on the framework for action to ensure that the ambitious goals of saving an estimated 50 million lives and reducing the number of zero-dose children by 50% can be realized over the next decade. The UN Foundation is committed to supporting partners and the Secretariat to operationalize this framework, building inclusive, cross-cutting, and coordinated constituencies that are rooted in community needs. We're proud to sign on to the Immunization Agenda 2030 open letter and encourage others to do the same, as we must build a broad coalition of partners to help deliver on these promises. As the UN Foundation believes that IA 2030 plays a crucial role in putting the world back on track for achieving universal health coverage and the SDGs. We also welcome the cross-regional statement presented and look forward to explicit commitments from country governments, private sector partners, global health leaders, and the development community to strengthen immunization programs, including for polio and measles, to achieve our collective ambition. Thank you.
Thank you to the United Nations Foundation Incorporated. I now pass the floor to the Task Force for Global Health Incorporated, to be followed by the Global Health Council.
Thank you. The Task Force for Global Health, in partnership with the US CDC, is pleased to contribute to several IA 2030 priorities, including vaccine equity, vaccination across the life course, disease control, elimination, and eradication, responding to outbreaks and emergencies, and strengthening health systems. As part of this partnership, the task force will work with 30-plus countries to strengthen their immediate and long-term capacity. CDC's new Global Immunization Strategic Framework is aligned with IA 2030. The task force is establishing a coalition of immunization partners to support implementation of IA 2030 and CDC's strategic framework, with emphasis on the vital role strong immunization systems play in global health security. We thank member states and WHO for your leadership and look forward to continuing to work closely with you to achieve our shared goals. Thank you.
Thank you to the Task Force for Global Health Incorporated. I now pass the floor to Global Health Council, to be followed by Drugs for Neglected Diseases Initiative.
Thank you. Global Health Council, in collaboration with PATH, is grateful to have the opportunity to comment. The COVID-19 pandemic has threatened decades of progress and gains made through immunization campaigns around the world, and increased the incidence and threat posed by AMR. We urge WHO and member states to strengthen vaccine-related research and innovation according to community needs, particularly for underserved populations. We call on WHO and member states to focus on the full spectrum of innovations that support immunization programs, including storage, manufacturing capacity, new vaccine administration, infrastructure, and novel service delivery that encourages vaccine confidence. We ask member states to integrate accountability mechanisms for commitments made to IA 2030, including an annual mechanism for reporting progress through the EB and wider assembly. Finally, there is waning private investment in antibiotic development and thus too few new antibiotics. Member states should invest in new tools to fight AMR. Other proven strategies.
I apologize for the interruption to our dear colleague from Global Health Council. Your time has expired. I now pass the floor to Drugs for Neglected Diseases Initiative, to be followed by the International Pediatric Association.
Thank you. Honourable delegates and chairperson, the growth of drug-resistant infections is a silent pandemic. Left unchecked, humanity will be unable to treat common infections or secondary bacterial infections in viral pandemics. Like COVID-19, drug-resistant bacteria can infect anyone of any age in any country. Unlike COVID, we can prepare now. The drug-resistant microbes are known, and meaningful change can be achieved with political will and resources. Member states can prepare by investing in the development of medical countermeasures, including diagnostics, treatments, and vaccines, ensuring access for all, including developing new mechanisms to secure access to existing and new treatments, expanding global cooperation across geographies and sectors within One Health framework, and ensuring low and middle-income countries are equal partners in a comprehensive global response. We thank the World Health Organization and our funders for their support of Gavi's development of new treatments. Thank you.
Thank you to Drugs for Neglected Diseases Initiative. We have a member state, Madagascar, who has requested the floor. Madagascar, the floor is yours. Madagascar, we apologize. There seem to be some technical difficulties. If you are online and ready, would you be able to begin your intervention from the beginning?
Thank you very much, Mr. Moderator. Madagascar has the honor of speaker on AMR. And we fully align ourselves with the declaration that was made by Burkina Faso on behalf of the African region. The government has joined the international effort to fight AMR through the signature of a political declaration which came out of the high level of a National Assembly of the UN Assembly on this subject. Madagascar is part of the 10 African countries who are part of the AMR surveillance network. The recommendations of the application of health standards in Madagascar, and specifically the elaboration of a national plan of action and the updating of the national policies on this subject, as well as adding the issue of looking at emerging diseases, is something that we're working on. Madagascar is acceding to the international surveillance system, and actually we have acceded to it since July of 2017, and we're redoubling this at a national level. Madagascar has also put into place a multi-sectoral committee to fight AMR, which has actors from different ministries and different bodies. They work on animal, environment, and public health. We have developed a national plan of action on antimicrobial resistance, and this goes hand in hand with the global plan of the WHO and the following strategic axes. First of all, awareness raising, communication about what happens with AMR, strengthening data and reducing the number of infections through hygiene and prevention, optimizing the use of antibiotics in animal health, in the environment, and public health. And of course, lastly, trying to find other alternative solutions. However, the application of this national plan of action to fight AMR must respect the One Health approach, as well as the lab capacity of our government. They need to be boosted to the next level. In terms of technical capacity, we need to make sure that there's proper coverage. Financing must be available. We therefore entreat the assistance of international financial partners. I thank you very much for your kind attention.
Thank you, Madagascar. I now pass the floor to International Pediatric Association, to be followed by Water Aid International.
Thank you, Chair. We believe in power of vaccines, and we hope that vaccine will get us towards the end of this pandemic. The global impact of pandemic has put stress on delivery of other essential health services, including routine immunization. Drives for children and efforts are needed to revamp and strengthen the routine immunization services. As the foundation of vaccine acceptance is public trust and trust in the healthcare professional, in December 2020, IPA, in collaboration with partner organizations, launched the IPA Vaccine Trust Course with the aim to increase the communication and advocacy skill set of health workers. Ultimately, it is not going to be an easy task in dealing with vaccine-related misinformation and various other challenges, ensuring equitable access to vaccine, and IPA fully support Immunization Agenda 2030 and look forward to working with WHO and partner, ensuring everyone, everywhere, at every age gets full benefit from vaccine to improve health and well-being. We also fully support plan to
Esteemed
address
colleague
patient
from the
safety
International
and
Pediatric Association, I am sorry to interrupt. I now pass the floor to Water Aid International, to be followed by the World Federation of Societies of Anesthesiologists. We will return to Water Aid International. In the interim, we will now continue with the World Federation of Societies of Anesthesiologists. The floor is yours.
Madam Chair, the World Federation of Societies of Anesthesiologists, a member of the WHO Global Patient Safety Network, is at the forefront of efforts to improve and embed patient safety into clinical practice and standards. The WHO-WFSA International Standards for Safe Anesthetic Practice were developed to support countries to implement minimum standards of anesthesia care. Patient safety is inextricably linked to healthcare worker well-being. The COVID response has put further pressure on anesthesiologists and intensivists at a time when low health workforce numbers is placing additional stresses on already strained health systems. The WFSA therefore urges member states to, number one, develop guidelines which prioritize and protect the professional well-being of healthcare workers, and secondly, work with WFSA member societies to implement the WHO-WFSA international standards. I thank you.
Thank you, World Federation of Societies of Anesthesiologists. I now pass the floor to the International Pharmaceutical Students Federation, to be followed by the International Federation of Gynecology and Obstetrics.
Honorable Chair, distinguished delegates, it is a great honor to speak on behalf of the International Pharmaceutical Student Federation, IPSF, which represents more than 500,000 pharmacy students and recent graduates in more than 100 countries worldwide. Patient safety is vital to achieve both universal health coverage and health-related SDGs. IPSF calls for the productive collaboration between government stakeholders and health professionals, acknowledging the key role of youth as the future of the health workforce to implement patient safety principles. IPSF believes that training and education should be widely provided to raise awareness on patient safety and urges WHO to foster more youth involvement in all related initiatives. Antimicrobial resistance is the next pandemic awaiting to emerge if inappropriate use of antimicrobial continues. IPSF commends WHO efforts on developing national action plans and calls on the member states to recognize and include youth and civil society in their plans. Thank you.
Thank you to the International Pharmaceutical Students Federation. I now pass the floor to the International Federation of Gynecology and Obstetrics, to be followed by Medicus Mundi International Networks Health for All.
Thank you, moderator, your excellencies, colleagues, and friends. Patient safety in women's health care requires a multidisciplinary collaboration of healthcare professionals and patients to drive culture change. A just culture balances the need for open and honest reporting with the need for quality learning environment. It requires a change in focus from errors and outcomes to system design and management of behavioral choices. Successful reductions in maternal morbidity and mortality have involved evidence.
The interpretation department apologizes. There is a technical issue. We're having Arabic on the English channel.
Care create a safety culture that decreases complication and improves outcomes. Likewise, attention to adequate support for the birthing environment, medications, water.
The interpreters apologize if the distinguished speaker.
Adequate facilities will reduce morbidity and mortality. These are critical elements of a safety culture. As we look towards the elimination of obstetric fistula this decade, we must demand an environment focused on safety. A woman whose health is optimized before pregnancy has a higher likelihood of a healthy pregnancy. Such conditions are made more likely by universal health coverage and adequate access to care. Likewise, in obstetrics especially, optimum
the International
healthcare
Federation
is prevention.
of Gynecology and Obstetrics. I apologize for the interruption. I now pass the floor to Medicus Mundi International Network Health for All, to be followed by the International Society on Thrombosis and Hemostasis Incorporated.
Okay.
This MMI statement is supported by PHM. A global immunization strategy is a key tool to increase access to vaccines and paramount for achieving the right to health. Such strategy should consider health system strengthening, research and development, and local production. Agenda 2030 should address the barriers imposed by IP rights and indicate how countries will be assisted to make use of TRIPS flexibilities. COVID-19 has shown the importance of scaling up local production through public health-led innovation policies and manufacturing capacity building. State-owned production facilities are vital in ensuring access in low and middle income countries. Agenda 2030 should promote transparency on the vaccine market to facilitate access through more affordable pricing. It should address health system strengthening and health workers shortages. Health for all cannot be achieved without strong health systems, as access to vaccines cannot be attained without health workers. Thank you.
Thank you, Medicus Mundi International Network Health for All. I now pass the floor to the International Society on Thrombosis and Hemostasis Incorporated, to be followed by the United States Pharmacopeal Convention. Hearing no intervention at this time, we will continue with the United States Pharmacopeal Convention. The floor is yours.
The United States Pharmacopeal Convention, a nonprofit organization that sets standards for the identity, strength, quality, and purity of medicines, food ingredients, and dietary supplements worldwide, is committed to addressing AMR. Poor quality or substandard medicines, i.e. those that fail to meet quality standards or specifications, or both, are an often unrecognized driver of AMR. AMR emerges not only when a pathogen is exposed to substandard antimicrobials, but can also spread within a product class. In other words, new antibiotics may not always treat infections effectively. COVID-19 has intensified the AMR crisis in the following ways. COVID pandemic has diverted finite resources and political will, overstretched regulatory systems that are less able to detect poor quality antimicrobials. USP supports a comprehensive global approach to addressing AMR, including preserving the global supply of antimicrobials,
esteemed colleague
identifying
from United
risks
States
upstream.
Pharmacopeal Convention, I apologize for the interruption. Your elapsed time has expired. I now pass the floor to the Union for International Cancer Control. The floor is yours.
Thank you for the opportunity to deliver this statement on behalf of UICC, supported by the NCD Alliance. In order to continue to improve cancer care and NCD outcomes, it is critical to accelerate actions tackling AMR, and we urge member states to ensure the provision of data into the global antimicrobial resistance surveillance system to ensure global data sharing, adopt multi-sectoral policies for access to and rational use of antimicrobials and diagnostics in addressing this growing problem, address the issue of substandard and falsified medicines by ensuring the quality of antimicrobials, engage in multi-sectoral partnerships and sustained investment to address the increased need of R&D for novel antimicrobials and rapid diagnostic tests, and to also engage the cancer and NCD community, infectious diseases groups, and other stakeholders to collaborate in raising awareness of AMR, sharing of best practices, and capacity building of R&D for new antimicrobials and diagnostics. Thank you.
Thank you to the Union for International Cancer Control, and thank you to these valued non-state actors. Member states, prior to passing the floor back to the esteemed chair, we would like to confirm there are no further requests on this agenda item 13.1, 13.5, 13.8.
Thank you very much. I shall now give the floor to Dr. Susan Jacob, Deputy Director General, to lead the Secretariat's response. Dr. Jacobs, you have the floor.
Thank you very much, Madam Chair, for giving me the floor. Dear Excellencies, Member States representatives, partners and colleagues, first of all, I would like to express our gratitude and appreciation to all Member States who spoke today and for all the strong support we received on these three agenda items. In our replies, we will start with agenda item 13.1, which is the patient safety. As many of you have said, the catastrophic effects of the COVID-19 global pandemic have brought increased recognition of the risks and harm to patients. And this Global Action Plan on Patient Safety, as many of you said, is even more timely now than it was when we started to develop it. Let me pick up three issues. First on the process, the second on the implementation, and the third one on the linkages. With regard to the process, following the REACH discussions we had at the Executive Board, you asked us to extend the timeline for receiving comments till mid-February 2021. We did indeed extend the timeline, and during this period, we received a lot of insightful, extremely valuable, and very constructive feedback, and the detailed comments and guidance from many member states, which helped us to further strengthen the action plan. I'm very happy to inform you that all your suggestions have been carefully reviewed and duly incorporated into the Global Action Plan. We had an information session with member states on the 23rd of March to brief member states on the updates made in the action plan based on your suggestions. Member states expressed their overall support and satisfaction on how the final draft has shaped and evolved, and also with the inclusive process, which was confirmed also by the delegations today in the discussion. And I would like to thank all of you for your input, which helped us to make this Global Action Plan a good piece of work and document. The second issue is about the implementation. Of course, it is very important to implement the Global Action Plan, and this is why we have developed this. And in this implementation, the transformative flagship initiative, A Decade of Patient Safety 2020-2030, that we launched recently to implement the Global Patient Safety Action Plan, will be extremely helpful. In this initiative, we will provide technical guidance to the countries to establish sustainable and robust patient safety systems. We will offer normative guidance and tools and customized technical support to countries for developing national patient safety action plans. We are all looking forward to working with you, and we were very happy to hear from many delegations today that you are committed to move along with the national action plans as it was expressed clearly today. I wish to thank member states for your continued support and commitment to this. And this was expressed by so many delegations, including Burkina Faso on behalf of the African region, Portugal on behalf of the EU and many other European countries, Qatar on behalf of the Eastern Mediterranean region, and many other member states who spoke up on this topic. The third issue that I would like to flag up is the linkages between the Global Patient Safety Action Plan and the other areas of work. First of all, this work has to go hand in hand with our work on IPC and hand hygiene, which has to be scaled up as well and put on a more sustainable path. And this was raised today also by delegations like Ghana, Zimbabwe, India, and UK, who emphasized the need for multi-sectoral engagement and collaboration for patient safety and linkages of patient safety, medication safety, IPC, WASH, and AMR. The need for cross-learning and sharing of best practices was also emphasized. Then there is also no patient safety without health worker safety, which was further proved during the COVID-19 pandemic response. And we absolutely accept the comments made by Norway, Chile, Thailand, Qatar, Fuji, Burkina Faso, that it is an innovative concept to bring together health worker safety and patient safety at the same time. I would also like to mention that this was reflected already in the theme of the World Patient Safety Day 2020, which the motto of which was Health Worker Safety, a priority for patient safety, which was depicted precisely as an issue arising during the COVID-19 pandemic. And then finally, let me say that Philippines, Qatar, speaking on behalf of the Eastern Mediterranean region, countries like Fiji, Tanzania, highlighted the importance of monitoring and reporting to assess the reduction in harm in healthcare. WHO will be reporting on the progress of Global Patient Safety Action Plan between 2021 and 2030, to the World Health Assembly. The next reporting will be at the 76th session of the World Health Assembly. So with this, I would like to thank member states for noting the DG's report on global action on patient safety and adopt the decision contained in the decision EB 148/5, which of course the chairman will ask you whether you are ready to adopt it, but what we heard was positive. So thank you for this, and with this, ladies and gentlemen, we move on to the next item, which is 13.5 on antimicrobial resistance. And we will do the reply jointly with Dr. Hanan Balki, ADG for antimicrobial resistance. Let me make two short introductory comments before I pass it on to Dr. Balki. First of all, it is important now to focus on strengthening country capacity in order to accelerate the implementation of the AMR action plans. In low and middle income countries, implementation of the plans remains a challenge. And as many of you said, this will have to be done in the One Health spirit with high-level commitment. In WHO recently, we have significantly scaled up our work on One Health, working hand in hand with FAO, OIE, UNEP, and you have seen the first meeting of the AMR Global Leaders Group as well as the high-level One Health expert panel, which are clear indications and signs of this upgraded work. And internally, we have also organized ourselves in such a way that we can meet the challenges of this cross-cutting horizontal issue. The second issue I wanted to flag up is that especially now, within the context of COVID-19, it is essential for each country to prioritize activities and integrate modes of service delivery aligned with the COVID-19 response by enhancing infection prevention and control, laboratory and surveillance capacity, antimicrobial stewardship, WASH, and supply chain management. And as we continue to tackle the COVID-19 pandemic, we must simultaneously ensure that efforts to stop the spread of antimicrobial resistance are accelerated and confront this silent AMR pandemic together. And here I would like to hand over to Dr. Balki, who is the Assistant Director General of AMR, who will respond to other specific issues. Hanan, over to you.
Thank you, Dr. Jacob. Your Excellencies, distinguished delegates, partners, and colleagues, thank you for your valuable comments, support, and commitment to the AMR agenda. Antimicrobial resistance is and has been a threat to human health for decades. The failure in addressing this threat is further compounded by the burden of the continuous COVID pandemic. The AMR division will continue to engage our member states and partners in implementing and identifying innovative solutions to respond to this global threat. Although the division is still young, we continue to support member states in accelerating the implementation of their AMR national action plans with a major focus on supporting multi-sectoral One Health coordination and are committed to help build sustainable capacity at national level. From the TRAC's recent report, and as many of you have mentioned today, the national action plans that are funded are only 15% in the countries that are monitored. That is why we need sustainable financing mechanisms or funds to support, in particular, the national level response. We need to provide the necessary tools and innovation that will spare the misuse of antimicrobial agents. These tools include, but are not limited to, therapeutics, diagnostics, vaccines, waste management for both human and animal health. And we need to create a healthy environment that takes into consideration all lives where hygiene and infection prevention and control are at its center. And we need to protect the human life by ensuring proper access to effective and affordable antimicrobial agents. The implementation of the newly approved AMR SDG indicator, resistance from bloodstream infections, will expand and improve on the global antimicrobial resistance and use surveillance system GLASS in supporting country laboratory strengthening and justifying the prioritization of AMR as an important element of the UN Sustainable Development Corporation framework. And that has been alluded to many of you in your interventions and statements. We are highly encouraged by the role played by the AMR Global Leaders Group, led by Prime Minister Sheikh Hasina of Bangladesh and Prime Minister Mia Mottley of Barbados, to build the political momentum that will help us achieve these critical needs. Finally, I would like to thank you, the member states, for the interventions and for your commitment specifically on progress and the achievements that you have had, and looking forward to continued collaboration on the AMR agenda. Thank you very much.
Thank you very much to Hanan Balki. And I would like to invite Regional Director, Southeast Asian Region, to take the floor.
Thank you very much, Susanna. Honorable Chair, distinguished delegates. Long before AMR reached the global stage, the ministers of health of Southeast Asia met in India in 2011 and adopted a ministerial declaration on antimicrobial resistance and the threat it exposes humanity to. I agree with Thailand that the progress is uneven across the globe. Since then, the region has continued to build on that momentum so that most countries now have a national plan of action on AMR. However, there are implementation challenges, which was well recognized in the statement by Bangladesh. Further, all countries are participating in the Global Antimicrobial Resistance Surveillance System, or GLASS, which was just referred to, and all countries carry out the tripartite AMR self-assessment exercise. Recognizing the need to focus on this important emerging issue and to give it the attention it requires, AMR became a flagship priority for the region in 2014. For several years now, all countries in the region have been implementing multi-sectoral national action plans that are aligned with and reflect the One Health approach. Earlier today, India underlined the importance of the One Health approach. CRO's leadership and commitment as co-lead of the only regional tripartite that was announced in 2018 strengthened an integrated and holistic approach to fight the threat of AMR. To take further the commitment of the member states in this important area of work, Bangladesh is assuming the joint leadership of the Global Leadership Group on AMR to strengthen accountability and global governance. The active participation of the region in Multi-Partner Trust Fund to support the development and implementation of national action plans similarly highlights the high-level commitment of the member states. Indonesia's point to invest on research and development for new antimicrobial agents is noted. Across the region, targeted efforts to enhance regulatory capacity and antibiotic stewardship continues to be rolled out, including through WHO's AWARE classification tool, which 5 countries have now adopted, with more to follow. At the regional office level, there is a multidisciplinary AMR working group, as well as a technical advisory group with renowned global experts. It is estimated that by 2030, AMR could force up to 24 million people into extreme poverty. And by 2050, the estimated number of AMR-related deaths may reach up to 10 million. And this situation is further compromised with the ongoing pandemic of COVID-19. The WHO Southeast Asia region is therefore committed to do its best to prevent and combat antimicrobial resistance as a global health and development threat. Thank you.
Thank you very much, Dr. Singh, for your leadership and commitment in the Southeast Asian region. With this, ladies and gentlemen, we move on to agenda item 13.8, immunization. And let me start by thanking you for your valuable guidance, both in the regional and in the national statements. The Immunization Agenda 2030 defines what needs to happen over the coming decade to achieve a vision of a world where everywhere, everyone at every age fully benefits from vaccines for good health and well-being. It positions immunization as an integral part of primary health care to help to achieve universal health coverage and the SDGs. It provides us a framework, an umbrella, for all issues related to vaccines and immunization, guiding the regions and the countries to develop operational frameworks. And it is not owned by one single agency, but rather co-owned by all the immunization stakeholders. We are at the start of a new immunization decade, and it is now time to move from the vision to a strategy for implementation. The framework for action gives us guidance on how to operationalize the Immunization Agenda 2030. And as many of you said today, as we move to the implementation phase, political will, as well as technical and financial resources will be needed to support country plans to maximize the benefits of vaccines and their delivery. I wish to thank Member States for your continued support and look forward to your strong engagement in the implementation during the framework of action, and your support both to routine immunization as well as COVID immunization within the COVAX facility is very much appreciated. And with this, I would like to call on Kate O'Brien, Director of Immunization, Vaccines and Biologicals, to address some of the specific issues that you raised. Kate, over to you.
Thanks so much, DDG. I just want to reiterate how delighted we are to hear the strong support by all 6 regions for the vision and strategy and the operational elements of IA 2030, which have been captured and described in the framework for action. It is, I have to say, frankly, inspiring that all regions and member states who have spoken are encouraging each other to develop these tailored regional and national immunization plans to make sure that the implementation of IA 2030 will now happen. And as Canada stated, supported by member states from all 6 regions, IA 2030 is this ambitious strategy to maximize the impact of immunization over the next decade, aiming for preventing disease, promoting equity, and building strong programs. And if fully implemented, it will avert an estimated 50 million deaths with targets that have been laid out. As many member states have highlighted, IA 2030 was developed to anticipate pandemics and regional outbreaks while maintaining a focus on progressive improvement in immunization programs over a decade. And little did any of us know that this would be the focus of the strategy as soon as it was launched. Within this context, the points that have been made by Burkina Faso, on behalf of, also speaking on behalf of other countries in the African region, Canada on behalf of many member states from the 6 regions, Portugal, Zimbabwe, Colombia, Paraguay, and Norway, among others. The recovery of essential immunization programs from the impact of the pandemic is a high priority and means that the decade is beginning from a point of disruption. A reminder that to all of us, all of you, that on July 15th just in about 6 weeks, we will release the estimates, the WUNIC estimates, 2020 estimates of global vaccine coverage, which are also country and subnational estimates. And this will provide our best current estimates of the disruptions that have happened. The COVID-19 pandemic has disrupted essential primary healthcare services, including immunization, and left many children at risk of life-threatening diseases, as you have pointed out. It's also reminded us of the exceptional value of vaccine and its rate of return. You've commented, Botswana, China, and Colombia commented very strongly on the economic investment needed, the funding and financing needed, and noted the commitment needed to fully achieve those country-specific IA 2030 goals. And we're very pleased with the commitment to the ownership and accountability mechanisms that would achieve that. We also note the comments from many member states about the imperative for COVID vaccine supply and fair and equitable access of those vaccines. In particular, Bahamas spoke about the small island states and the particular issues that small nations are facing. And then finally, many comments from Canada on behalf of the 6 regions, Australia, Portugal, and the European countries on vaccine confidence as a threat that is threatening not only routine immunization programs and antigens of all sorts, but very acutely now with the COVID response, COVID vaccines, and the focus that WHO needs to increasingly make on vaccine confidence to address misinformation and hesitancy. The challenges of operationalization were well noted by many of you, and achieving the impact laid out will indeed require resilient and unrelenting commitments, as slipping back is always looming and has been experienced by nearly every country in this past year. So we're really encouraged by the strong support of all of you for IA 2030 and the critical backbone that immunization provides to primary health care and universal health coverage. Thank you.
Thank you very much, Kate O'Brien. And I would like to call on Regional Director Afro to take the floor, please.
Thank you very much, Susanna, and honorable ministers, delegates, partners, and colleagues. Routine immunization has contributed to halving the death rate among children under 5 in sub-Saharan Africa in the past 20 years, and has been pivotal in kicking wild polio virus out of Africa. Yet every year, it's estimated that 9 million African children miss out on this cost-effective, high-impact intervention. At the regional level, routine immunization coverage has stalled at between 70 and 75% in the past 10 years, well below the 90% target. So operationalizing the Immunization Agenda 2030 is a top priority in the African region. Through a rigorous consultation process, we've developed a regional framework to take forward the global agenda. It is anchored in the global vision and aims to improve immunization coverage using a primary healthcare approach. In the Addis Declaration on Immunization in 2017, African heads of state committed to achieving universal access. Now, increased domestic investment is needed with support from partners to realize this goal. This week, we've discussed the importance of vaccine equity and the need for countries with supplies to quickly and significantly share their doses to make a difference in the COVID-19 pandemic. In parallel to the intense demands on the COVID-19 vaccine rollout, supplementary immunization campaigns for other priority diseases like measles, yellow fever, and polio are equally important to sustain the progress made and to control outbreaks. Specific attention is needed to reach children in poorer families and underserved communities and those living in fragile, conflict-affected areas. Again, equity is a key principle driving our work. We also need to redouble efforts to address the growing vaccine hesitancy in the region and globally, and to engage and motivate caregivers to bring their infants and children to get vaccinated. Finally, scaling up vaccine manufacturing in African countries is an important medium-term strategy to build more resilient supply chains and improve access to these global public health goods. And we are glad to note that at the political level, at the level of ministers of health, our leadership is very determinedly embarking on this. In the region, we are supporting countries on all these fronts and encourage additional investments to drive down vaccine preventable diseases and save lives. And thank you very much for giving me this opportunity.
Thank you very much, Dr. Moeti, for your strong commitment to immunization in your region and your leadership. And with this, I would like to invite Regional Director, Western Pacific Region, to take the floor.
Chair, honorable ministers, distinguished delegates, the topic of immunization is very important to the Western Pacific region. We are, unfortunately, all too familiar with the challenges of vaccine-preventable diseases, from large-scale measles outbreak affecting the vulnerable in the Pacific to recurring outbreaks of circulating vaccine-derived polioviruses. Which is why member states unanimously endorsed the Regional Strategic Framework for Vaccine-Preventable Diseases and Immunization in the Western Pacific 2021 to 2030 at our 71st Regional Committee meeting last year. This regional framework serves as the implementation plan for the Immunization Agenda 2030. The regional framework tailors the global strategy to our regional context. In the Western Pacific, aging is recognized as a common challenge that we have to prepare for. So we are expanding immunization services beyond childhood. Member states in our region are rapidly developing. It is important that we leave no one behind. So we are improving surveillance systems and services to reach the unreached. And because of our experiences with the past outbreaks, we want to strengthen programs so that we can quickly respond. While immunization teams have been working on routine immunization, they have also been engaged in the COVID-19 response alongside incident management teams. Our regional and country offices work as one to fully utilize the framework in supporting countries with the rollout of COVID-19 vaccines. As we know, COVID-19 vaccination programs include the elderly as the key priority group. They also highlight the importance of reaching the unreached and making sure nobody is left behind. We would like to commit to working with the member states to leverage the experience of COVID-19 vaccination to lay the groundwork for the future immunization system and move towards the Immunization Agenda 2030 goals. Thank you very much.
Thank you very much, Dr. Kasai, for this excellent comments and very strong commitment from your region to implement the framework, the global framework, and to be part of this work jointly with the other parts of the organization. So with this, Madam Chair, I hand it back to you. We came to the end of the Secretariat responses. Back to you.
Thank you very much to all the speakers and especially to you, Dr. Jacob. Is the committee ready to note the reports contained in document A74/9, A74/9 and A74/10, Rev 1? The reports are noted. We will now consider the draft decision contained in EB 148/5 on global action on patient safety. The financial and administrative implication of these decisions may be found in document A74/10-4. May I take that the committee is prepared to approve this decision? I see no objections, so the decision is approved. I would like now to invite the Director General, Dr. Tedros, to have the floor. Dr. Tedros, es un placer darle la palabra.
I'm pleased to give you the floor, Dr. Tedros.
Yes, Chair. Almost everything has been said, so I will just say a few words. First of all, I would like to thank Member States for all your inputs. And then on patient safety, the key is now the adoption of the Global Patient Safety Action Plan, the 10-year roadmap and framework. So what's left now is the implementation. And we have to focus on the implementation, and result can only come at country level. So this should lead to action plans in all countries and implement all the necessary actions included in the action plan. So that's one. The second, on patient safety, we hear you very clearly. The second part is especially there is no, as you say, there is no patient safety without health worker safety. So our investment in helping our health workers to be safe is very critical. So these are the two issues I would like to raise. On AMR, I fully agree, and many of you have said it, putting AMR at the highest level of our global agenda is very critical. But to add to that, it has to be at the highest level of national agenda too, and including at subnational and including at the front line where the action is taken. We have to take it seriously, and as many of you have already said, this is an urgent issue, and it has to be treated with urgency. So that's one. Then the second, with regard to AMR, is we're committed as WHO to continue to coordinate the multi-sectoral response of AMR as a One Health approach, and we're doing our best and we will continue to do our best. But I would like to use this opportunity to thank Her Excellency Prime Minister Motley and Her Excellency Prime Minister Sheikh Hasina for their leadership to the One Health Council leaders group. And WHO will continue to coordinate with our partners. And then on the other important forum, maybe I'd like to recognize is the meeting that was convened, the high-level dialogue by the UN General Assembly President, and that called on countries and stakeholders to step up their actions as stipulated in the call to action. This will help us in not only increasing awareness, but ensuring political commitment and political will at all levels. So the UN General Assembly platform will be critical, and while thanking the President of the UN General Assembly, we need to continue to use that platform to mobilize political will. So these are the issues I would like to add to the AMR. On immunization, the two things on immunization. One is the disruption and the impacts of the pandemic on our regular immunization, and addressing the challenges that you have all identified is really key. So that's one where we will focus. And the second part is on vaccines for COVID. You see the disparity and the divide between the haves and the have-nots. We have already discussed this many times. That's very unacceptable. There are countries who haven't even started vaccination, while there are countries who have already vaccinated more than 50% of their population. This disparity will not help us to beat the pandemic. It will not help us to beat the virus. The virus actually will continue to get a space to circulate, and more variants could appear, and making even the vaccines we use ineffective. So increasing the vaccination coverage as soon as possible is in the interest of each and every country, and we seek your support to advocate and also act for vaccine equity, which is in the interest of all of us. So thank you so much again for your inputs, and thank you, Madam Chair, and back to you.
Thank you very much, Dr. Tedros. The agenda item is now closed. We will now take up the agenda item 13. Review of an update on matters considered by the Executive Board under Pillar 1. 1 billion more people benefiting from universal health coverage, sub-items 13.4, Global Strategy and Plan of Action on Public Health, Innovation and Intellectual Property. 13.6, Substandard on Falsified Medical Products. And 13.7, Standardization of Medical Device Nomenclature. The relevant document is A74/9. Under item 13.4, the Health Assembly is asked to give due to consideration to the outcome of the intersessional consultation on the draft resolution presented to the Executive Board at its 148th session on strengthening local production of medicines and other health technologies to improve access. Under this item, we are also invited to consider the draft resolution contained in document A74/A/conf/1. I would like to remind you that it has been agreed that under this grouping of agenda items, groups of non-state actors are invited to make intervention as a constituency. This statement will be taken during the debate among members of state and are limited to 3 minutes. Will those delegates wishing to speak please raise their hands on the Zoom platform. Before we begin our debate, I first give the floor to Executive Board Representative Dr. Patrick Amos to make some introductory remarks. Dr. Amos, you have the floor.
Thank you, Madam Chair. In January 2021, the Executive Board, at its 148th session, opened the agenda item on the Global Strategy and Plan of Action on Public Health, Innovation and Intellectual Property. The Chair drew attention to a draft resolution proposed by 11 member states on strengthening local production of medicines and other health technologies. The Executive Board noted the report produced by the Secretariat. 15 member states spoke and 2 regional statements were made in support of this agenda item, highlighting the relevance of innovation and intellectual property during the COVID-19 pandemic and the coordinated work among UN agencies. Member states positively anticipated the Secretariat's finding on the member state questionnaire on implementation progress. The Secretariat responded that it would present its findings and continue to report on the implementation plan 2020-2022. The Chair noted that the consultations on the draft resolution would continue in the intersessional period with a view to the submission of a final version to this Health Assembly. The Executive Board then considered 2 reports jointly. One report on substandard and falsified medical products, EB 148/12, from the 8th and 9th meetings of the Member State Mechanism on Substandard and Falsified Medical Products pursuant to Resolution WHO 1665.19. The second report on standardization of medical devices nomenclature, EB 148/13, in response to the mandate given by the Executive Board at its 145th session that requested the Secretariat undertake further work on a report presented at that time and in consultations with member states. 15 member states spoke and 3 regional statements were made in support of these agenda items. Regarding substandard and falsified products, support was expressed for the progress made by the member state mechanism and to the Secretariat for work to reduce circulation of substandard and falsified medical products. Member states noted that increased demand and supply chain disruption caused by COVID-19 pandemic that may lead to an increase in substandard and falsified medical products, particularly in the context of e-commerce. Relating to standardization of medical device nomenclature, member states noted the merit of harmonization in proposed classification, coding, and nomenclature and noted the need for a mechanism of review by key stakeholders. Member states further highlighted the importance of continued discussion with key stakeholders and for the Secretariat to keep member states updated regarding any related outcomes. At the completion of the discussion, the board noted these 2 reports that are now to be discussed by this Assembly. Thank you, Madam Chair.
Thank you very much, Dr. Amos. I would like now to give the floor to the moderator to manage the list of the speakers.
Thank you, esteemed Chair. I would like to invite Portugal to take the floor, to be followed by Ethiopia. Portugal, the floor is yours.
Thank you, Chair. Director General, Excellencies, colleagues, I have the honor to speak on behalf of the European Union and its member states. The candidate countries of Republic of North Macedonia, Montenegro, and Albania, the country of stabilization and association process and potential candidate Bosnia and Herzegovina, as well as Ukraine, the Republic of Moldova and Armenia, align themselves with this statement. The European Union and its member states welcome the resolution on the local production of medicines and other health technologies to improve access. The EU is committed to universal health coverage and increasing the resilience of health systems, including the supply of medicines and other health technologies. The current crisis is demonstrating more than ever the need for medicines production capacity across the world. We are committed to supporting those efforts, and that is why we are delighted to co-sponsor this resolution. In the response to COVID-19, it is essential to ensure timely, fair, and equitable access to quality, safe, and affordable diagnostics, therapeutics, and vaccines as a global public good. Currently, the EU is the largest exporter of COVID-19 vaccines to the world. Further ramping up production throughout the world and along the entire supply chain will be essential to achieve worldwide immunization. The EU and its member states are committed to support the establishment of sustainable manufacturing hubs for health technologies in the global south, in particular in Africa. Therefore, we call on WTO and the WHO as well as all member states to promote and facilitate cooperation between health technology developers, manufacturers, and investors. The European Union is committed to support the development of production capacities through an adequate environment by strengthening regulatory frameworks, supporting regional manufacturing hubs, and stimulating the voluntary transfer of technology and know-how, as well as research capacity. At the same time, it is crucial to reinforce competitive markets for affordable, high-quality, and safe health technologies. Chair, the EU and its member states value the work of the Member State Mechanism on Substandard and Falsified Medical Products. The national regulatory authorities have been under substantial pressure in the context of the COVID-19 pandemic. We encourage WHO and member states to keep an impact-driven approach to support regulatory institutions to tackle substandard and falsified medical products and to ensure access to quality, safe, efficacious, and affordable medical products. Regarding the standardization of medical devices nomenclature, the EU and its member states commend the Secretariat for having responded to the need for continued discussion with key stakeholders on the outcomes of this process by organizing an information session on 12th of April and by conducting a series of stakeholder meetings. The EU has recently published the European Nomenclature of Medical Devices, which is up for consultation and complies with all the requirements of WHO. We encourage the Secretariat to finalize the development of an international system to harmonize medical devices nomenclature and call on all stakeholders to join forces for making this international nomenclature system as flexible, safe, and user-friendly as possible. Therefore, we strongly advocate to continue this work in a result-oriented manner and are confident that this systematic approach will lead to a solution that can be endorsed by all member states. Building bridges to harmonize parallel medical devices nomenclature systems is in our common and mutual interest. Thank you.
Thank you, Portugal. I now give the floor to Ethiopia, to be followed by Costa Rica.
Thank you, Chair, Excellency Director General, honorable delegates. The Federal Democratic Republic of Ethiopia is pleased to deliver this statement on behalf of the 47 member states of the WHO African region. The Africa member states acknowledge the importance of the effective implementation of the global strategy and plan of action on public health, innovation, and intellectual property, along with the recommendations of the independent review panel, which is a critical issue in the context of ensuring timely, affordable, and equitable access to medicines, vaccines, and diagnostics and therapeutics. The Africa member states give utmost priority and is committed to the implementation of the recommendations advanced by the review panel to build and improve capacity for local production, transfer of technology, management of intellectual property to promote public health and improving delivery and access. The COVID-19 pandemic has revealed the vulnerabilities of many low and middle-income countries, most of them African countries with no or low local production capacities, exacerbating their challenge of inadequate access to the most needed vaccines, medicines, diagnostics, and other health technologies. Member states require continued support in building capacity to cultivate enabling legal investment and technical environments for quality and sustainable local production. Africa member states strongly support the draft resolution on strengthening local production that calls for a holistic, collaborative approach in addressing the current and future challenge in promoting sustainable local production to improve access, which is a major concern during the current pandemic, and any other future public health emergencies. The draft resolution strengthens local production and know-how, promotes technology transfer and innovation, considers the TRIPS agreements and intellectual property rights in the context of local production, and strengthens the mandate for WHO to work with the continental bodies such as the Africa Union to provide member states with support to build capacity for local production. On the other hand, high prevalence of falsified and substandard medicines poses a real threat to the public health and economy of a country. Although the problem is a global issue, the magnitude reaches as high as 10% in developing countries, mostly in Africa, considering its low capacities in the medicine production, supply chain, and regulatory systems, among others. Inadequate regional harmonization and intersectoral collaboration also contributes to this problem. We therefore fully support WHO member states' mechanism on substandard and falsified medical products. Member states in Africa have been investing in improving access to medicines, vaccines, and other health products that are of high quality, safe, effective through establishing and strengthening national, regional, and continental medicine regulatory systems like the Africa Medicines Agency or AMA. We also urge the Secretariat to work with relevant national and regional and continental medicines regulatory authorities to build their capacity on prevention, detection, and response to substandard and falsified medical products. The member states support African Union decision to support TRIPS waivers for the COVID-19 pandemic. We take note of the importance of standardization of medical devices nomenclature system as it facilitates their management, regulation, and access by standardizing terms that enable communication despite linguistic and system diversity among member states. The nomenclature system should be scientifically sound, accessible, transparent, harmonized, and international standard. Finally, the Africa Group requests the Director General to promote effective implementation of the prioritized recommendations of the review panel, submit the draft resolution on strengthening local production of medicines and other technologies, and allocate sufficient resources to establish efficient system and team for effective implementation of the resolution. To this end, the Africa Group affirms its commitment to implement the proposed recommendations in the report. I thank you.
Thank you, Ethiopia. I now give the floor to Costa Rica, to be followed by the United States of America.
Thank you, President. I have the honor to speak on behalf of the 42 member states co-sponsors of the Solidarity Call to Action to realize equitable global access to COVID-19 health technologies through pooling of knowledge, intellectual property, and data, by which the WHO established the COVID-19 Technology Access Pool, CTAP. This statement, together with the complete list of supporters, will be uploaded in the website of the Assembly. It has been over a year since we launched the Solidarity Call to Action, calling on key stakeholders of the global community to voluntarily pool knowledge, intellectual property, and data necessary for developing COVID-19 tools. Reality has shown that the call to action remains more relevant than ever, and that ensuring equitable access in all countries and regions to COVID-19 health technologies and tools, including vaccines, is of the utmost importance. We made the call for solidarity because we firmly believe that sharing knowledge, intellectual property, and data would leverage our collective efforts to advance scientific discovery, technology development, and broad sharing of the benefits of scientific advancements and its applications based on the right to health. A few weeks after the launch of the Solidarity Call to Action, the world learned of the historical breakthrough of the development of vaccines against the virus in record time. This due to the availability of resources and the global economic contribution to research. Yet, we have encountered significant challenges since then regarding production, distribution, and equitable access to the vaccines, diagnostics, oxygen, and other essential health technologies. We all agree that currently the most important priority of the global community should be to fight the COVID-19 pandemic, to halt its rapid transmission and reverse the global distress it continues to cause. We know that this goal is only achievable when everyone, everywhere can have timely access to the health technologies they need for COVID-19 detection, prevention, treatment, and response, included but not limited to universal vaccination. Today, more than ever, international cooperation and solidarity are vital to restoring global health security and for now and for the future. The pandemic has revealed the need to create new ways of working if we want to achieve equitable access to essential health technologies. The international community should continue to strengthen its capacity to be better prepared and better respond to future pandemics. Governments need to be at the forefront of the design of any access strategy, and we cannot relinquish our responsibilities. But we cannot succeed without NGOs, knowledge centers, international organizations, and last but not least, the private sector, to which we call to continue to step up efforts and engage more widely in serious conversations. The voluntary mechanism of the CTAP, together with other complementary initiatives undertaken within the WHO, set out a possibility to promote the availability of global public health goods based on equity, strong science, open collaboration, and global solidarity, in line with WHO's and UN Secretary General's efforts. Despite its pertinence and potential and the important voices who have joined in calling for its implementation, the solidarity call to action has not yet reach all those who are in best position to support and contribute to the initiative. This is why, once again, we call on all relevant stakeholders, including the industry and governments, to join the call to action, to use the CTAP platform and ensure that humanity can turn the page and start its way back to recovery. I thank you.
Thank you, Costa Rica. I now give the floor to the United States of America, to be followed by the Philippines.
Thank you very much. The COVID-19 pandemic has demonstrated the urgent need to strengthen global supply chains, including through enhanced, sustainable, and strategic regional and local production, strengthen regulatory systems to enable access to quality assured products, and facilitation of trade in key health products. The United States is very pleased to co-sponsor the resolution on strengthening local production of medicines and other health technologies to improve access. Strong regulatory systems are a precursor for local production to contribute to greater access. The extraordinary circumstances of the COVID-19 pandemic call for extraordinary measures. The United States believes strongly in intellectual property protections, but in service of ending this pandemic, supports the waiver of those protections for COVID-19 vaccines. Timely, continued access to safe, effective, and high-quality medical devices relies in part on implementation of a harmonized nomenclature system developed in cooperation with regulators, healthcare providers, and manufacturers. We remain deeply concerned by WHO's proposal to adopt the European Medical Devices Nomenclature, or EMDN, once finalized by the EU. EMDN is not harmonized with the Global Medical Device Nomenclature, or GMDN system, which is now free of charge and already utilized by 70 national medical device regulators from across all WHO regions. The United States urges that WHO complete the following actions before proceeding. 1, comprehensively map the proposed new nomenclature system against the already widely used GMDN to identify and minimize the negative impacts of a duplicate system on member states, medical device manufacturers, and other stakeholders. 2, determine costs and present the resource requirements for WHO to host a nomenclature system and to ensure its continued relevance for member states and stakeholders. 3, continue its cooperation with the International Medical Device Regulators Forum towards developing a harmonized approach and to consult with regulatory authorities, medical device manufacturers, and other appropriate stakeholders. We thank WHO for its work to prevent, detect, and respond to substandard and falsified medical products, and we look forward to participating in the working group considering enhanced coordination with other bodies conducting complementary work, such as the Asia-Pacific Economic Cooperation. We recommend that the member state mechanism on substandard and falsified medical products prioritize activities for 2022 to 2023, include mitigating the distribution of substandard and falsified medical products in informal markets, excluding internet sales. Finally, we encourage all WHO member states to join us in actively participating in the member state mechanism on substandard and falsified medical products. Thank you very much.
Thank you to the United States of America. I now give the floor to the Philippines, to be followed by the Russian Federation.
Thank you, moderator.
Honorable Chair, distinguished delegates. The Philippines fully supports the recommendations of the Global Strategy and Plan of Action on Public Health, Innovation, and Intellectual Property to prioritize research and development, build innovation capacity, promote technology transfer, and strengthen country capacity in applying TRIPS flexibilities. We also join the call of many member states to remove the barriers in intellectual property rules that will help the international community in addressing the inequity in access to vaccines and treatments for COVID-19. We share the call of our colleagues across regions to promote the open sharing of know-how and technology that will enable our countries to end this pandemic together with global cooperation and solidarity. Honorable Chair, the Philippines also recognizes that waiving patents is only one of the many actions necessary to solve the critical shortages of vaccines and supplies for COVID-19. Bottlenecks in manufacturing, production, distribution, as well as access to raw materials have been experienced by our country amid this pandemic. This strengthened our resolve to create a national roadmap for a resilient, responsive, and self-reliant supply system, which we hope to achieve over the next decade. Toward this end, on the resolution calling for the strengthening of local production of medicines and other health technologies, we thank Ethiopia for leading the negotiations and are glad to be listed as one of the co-sponsors. We express our interest to work with the WHO and other partners in ongoing initiatives such as the WHO COVID-19 Technology Access Pool and the mRNA Technology Transfer Hub. We also take note of the reports on substandard and falsified medical products and support the work of the member state mechanism to ensure the traceability of health products and continuously build the capacity of national regulatory authorities. Lastly, the Philippines also commits to work with the WHO to come up with a standardized nomenclature for medical devices, which will facilitate good reliance practices across member states. Thank you, Chair.
Thank you to the Philippines. I now give the floor to the Russian Federation, to be followed by the World Organization of Family Doctors and the constituency members. Russian Federation, the floor is yours.
Thank you very much, distinguished chairperson, delegates. The Russian Federation endorses the report on the Global Strategy and Plan of Action on Public Health, Innovation, and Intellectual Property, and joins the co-sponsors of the related resolution. We note the priority of ensuring access for public health to innovative medicines and vaccines during COVID-19. In that regard, we welcome the work of the WHO on the matter, including at the WTO, with the TRIPS facilities, for example, flexibilities rather, as well as through discussions of expanding those to fight the pandemic. We are grateful for the WHO's initiatives and the initiatives of another number of countries to draft documents to build capacity in the area of medicine manufacturing and medical production in order to expand access and to strengthen preparation for the World Local Production Forum 2021. We appeal to countries to actively participate in this forum, which has gained even more importance during COVID-19, to ensure public health has the medicines and the medical devices that it truly needs. The Russian Federation supports the report's substandard and falsified medical products. The Russian Federation has been faithfully and actively contributing to efforts to prevent, flag, and to stop the illicit trade of such products as part of the WHO mechanism and as part of other international efforts, for example, the Council of Europe's Medicrime Convention. We note just how topical this subject is during the pandemic, where there were more illegal substances and dangerous and falsified medicines and even medical devices which appeared on the market, particularly on the internet. COVID-19 was not spared from the problem of counterfeits and falsified products, not even with regard to vaccines, which were used against COVID. We call on regulators and international organizations to work together to protect people and minimize the risks caused by this danger, using and disseminating the methodology and the literature and the mechanism of the WHO, as well as regional initiatives like the Medicrime Convention I mentioned. With regard to the standardization of nomenclature for medical devices, we note the report of the Director General, and we welcome the progress that's been made. We share the view that it doesn't make sense to develop a new WHO nomenclature, and we'd like to call for the use of the global nomenclature, the global medical device nomenclature, which is currently available for all and which is used widely by national regulators. I thank you very much for your kind attention.
Thank you to the Russian Federation. I now give the floor to the World Organization of Family Doctors and the constituency members, to be followed by Argentina. Several constituencies of non-state actors in official relations with WHO have requested the floor on this grouping of agenda items. According to the privileges conferred by WHO, I have the pleasure to give the floor to that first constituency of non-state actors presented by the World Organization of Family Doctors and joined by the constituency members, the International Diabetes Federation and the International Federation of Surgical Colleges. World Organization of Family Doctors, the floor is yours.
Distinguished people, the IDF, IFSC, and WONCA welcome the report on global strategy and plan of action on public health, innovation, and intellectual property. This coalition specifically appreciates the recommendations to address research and innovation difficulties in low and middle income countries, LMICs. We believe that LMICs are rich in global health research opportunities, and they have the human potential to do such research themselves. Rich countries often support junior researchers to do short research projects in poor communities, which usually just skim the surface of what the real public health issues are. The intellectual property of that research remains with the rich country institution, with LMIC healthcare workers sometimes not even recognized at all. We assert that primary health care has been embracing the principle of co-design, whereby research is conducted by and for, not on key stakeholders and end users. Yet there is also a relative paucity of PhD research in LMICs. Family medicine and other primary care training programs are often in the early stages of development. Academics in the field have yet to reach critical mass, and the workload demand on clinicians allows little time to also engage in research. The research capacity in an LMIC is further depleted by the brain drain and the lack of research funding. We call on WHO to support member countries in LMICs to own their own research data by supporting systems that actively stop the flow of research data from poor countries to rich countries. Researchers in LMICs should lead the project, sometimes with support from high-income countries. Innovations like the College of Surgeons for East Central and Southern Africa, Afro-PHC, or the African Research Collaborative are great examples recently put in place. Our recommendations are, first, ensure ownership and utilization of findings by end users by promoting embedding research as an integrated and systematic part of decision-making and implementation, which enables a country's policymakers, researchers, and communities to work together to collaborate on research projects, ensuing the principles of co-design and co-production. Second, waive author publication fees for peer-reviewed publications if the lead author is from an LMIC, so the research is freely available to those to whom the research pertains. Third, promote ring-fenced health research funding for primary care research in LMIC to ensure that community-based participatory primary care research does not compete with lab-based medical research for funding. Fourth, promote dedicated funded time for local primary care clinicians and teachers and practice-based research networks. Finally, embrace innovative methods in research methodology and teaching for young researchers in LMICs. We appreciate the opportunity to present this statement and call on the WHO and member states to help decolonize health research and property rights. Thank you very much.
Thank you to the World Organization of Family Doctors and the constituency members. I now give the floor to Argentina, to be followed by China.
Thank you, moderator. Thank you, Chair. Argentina takes note of the report. Argentina wishes to stress the ongoing relevance of the global strategy and plan of action on intellectual property, and notes with concern that many of the problems that drove the formulation of that strategy remain, particularly those related to medicines. We underline the importance of taking action to promote transparency of medicine pricing, since one of this is the main challenges that we currently face, we believe that price transparency must also be accompanied by specific action to promote the transparency of production costs, including in the value chain. As we've mentioned before in other fora, Argentina supports all regional and global initiatives to promote universal, equitable access to medicines, treatments, and vaccines, and guaranteing the equal access to these global public commons through free or affordable licensing. We underline the importance of the agreement on trade-related aspects of intellectual property rights, TRIPS, and public health, otherwise known as the Doha Declaration, and particularly the right of states to adopt the flexible arrangements provided for in the TRIPS agreement to guarantee affordable access to health technology. We are therefore certain that in order to overcome difficulties related to technology transfer and overcome barriers to accessing COVID-19 vaccines, it is absolutely indispensable to implement commitments and actions that allow local production of medicines, treatments, vaccines, and other health technologies. Lastly, with regard to the draft resolution strengthening local production of medicines and other health technologies to improve access, we would like to thank the delegation of Ethiopia for their presentation and welcome these efforts of member states to arrive at a consensus text. And Argentina is very pleased to be able to co-sponsor this text. Thank you.
Thank you to Argentina. I now give the floor to China, to be followed by the Republic of Korea.
Distinguished Chair, the Chinese delegation thanked the Director General and the Secretariat for their efforts in promoting global strategy and a plan of action on public health, innovation, and intellectual property, and look forward to the fourth report of the Secretariat survey on member states. Facing the COVID-19 pandemic, China hopes that all countries will further strengthen their communication, actively engage in constructive discussions, and work together to prevent and control the pandemic. China has timely developed and launched the information sharing platform for patents on pandemic prevention against COVID-19 in both English and Chinese version, which releases the patent information, research reports on drugs, vaccines, testing methods, masks to help research and development on the pandemic control. And this platform was warmly welcomed in China and overseas. In the context of COVID-19 pandemic, it is more challenging to actively promote the implementation of the priority actions proposed by the review group. We hope that the Secretariat will fully consider the impact of the COVID-19 on countries and further elaborate on the timing of the implementation plan. China proposed to fully assess the human and financial challenges that may be faced in the implementation and to develop an implementation plan based on the resource availability. Thank you very much, Chair.
Thank you, China. I now give the floor to the Republic of Korea, to be followed by the International Federation of Medical Students Associations and the constituency members.
Thank you, Honorable Moderator. The Republic of Korea thanks the Secretariat for preparing comprehensive report on technical items. I would like to deliver comment on each agenda item. First, Korea note the report on the global strategy and plan of action on public health, innovation, and intellectual property, which set out implementation plan along with prioritized recommendations. As we experienced the last year, the COVID-19 pandemic has highlighted the importance of access to quality, safe, effective, and affordable medicines and health products. In this regard, Korea expresses support for the draft resolution on strengthening local production of medicines and other health technologies to improve access. Given the complex production mechanism and supply value chain, Korea calls on the WHO to continue its close cooperation with the member states, as well as relevant intergovernmental organizations such as WTO. Next, substandard and falsified medical products. have become a more substantial threat than ever to global public health amid COVID-19 pandemic. As we are well aware, WHO has responded with various measures to tackle it, especially through its international cooperation mechanism. Korea reiterates its support for the WHO global surveillance and monitoring system and member state mechanism. Lastly, I would like to thank WHO for its commitment to standardizing nomenclature for medical devices and for keeping us updated on the progress at the International Medical Device Regulators Forum meetings and a virtual information session. Once WHO completes to work on standardized nomenclature, the internationally harmonized system will greatly benefit the countries that do not have or are planning to establish a solid nomenclature system. Korea believes that the harmonized system will substantially assist regulatory authorities and businesses and ultimately contribute to promoting global health. Korea hopes WHO will continue to keep us informed on the progress and looks forward to active discussions on how to manage the international classification, coding, and nomenclature for medical devices. I thank you.
Thank you to the Republic of Korea. I now give the floor to the International Federation of Medical Students Associations and the constituency members, to be followed by Thailand. This is the second constituency of non-state actors presented by the International Federation of Medical Students Associations and joined by constituency members, the World Medical Association and the International Pediatric Association. The floor is yours.
Honorable Chairperson, distinguished delegates, the implications of the COVID-19 pandemic have disproportionately affected vulnerable populations and highlighted global inequalities in the provision of health services and the distribution of essential medicines. However, the scarcity and unequal availability of health technologies predate the pandemic and pose a major challenge to global health. The International Federation of Medical Students Associations, the World Medical Association, and the International Pediatric Association strongly believe that access to essential medicines and health technologies represents the enforcement of the right to health and the idea of global solidarity and equity. Delivering on all essential medicines and products, including those on the WHO model list of essential medicines and of essential medicines for children, are critically needed to achieve global goals. Furthermore, strengthening the local production of medicines and technologies is crucial to achieving universal health coverage and sustainable development in all countries. We support WHO's leadership in implementing equitable access to health innovation and thus acknowledge the efforts put into the global strategy and plan of action on public health innovation and intellectual property. We, therefore, call upon the WHO to support all member states in the development and implementation of evidence-based and effective health technologies, ensuring their equitable distribution between and within countries. We urge the WHO to support member states in their efforts to increase population health literacy through modern technologies. Moreover, we call upon member states to guarantee access to innovations in healthcare to all members of society. Progress should benefit everyone, particularly those in need. Lastly, as future health leaders and digital natives with a unique and valuable perspective today, we urge member states to engage young people in education, development, and implementation of health innovations, thus contributing towards building resilient health systems whilst ensuring sustainable human development. Thank you.
Thank you to the International Federation of Medical Students Associations and the constituency members. I now give the floor to Thailand, to be followed by Belgium.
Thank you, Chair. During COVID-19 pandemic, our world has been facing with a big challenge on disease prevention and control, as well as treatment. However, disparity shown. While many countries have plenty of vaccine, antiviral medicines, and medical supplies, there are scarce in others. With regard to the situation, Thailand would like to underscore three significant issues on medical products. Firstly, GSPOA on PHI agreed since more than a decade ago has been proved that it is a thorough strategy and plan that fit to the COVID-19 vaccines. From R&D through delivery and access, it can contribute to support many developing countries. We strongly encourage the Secretariat to accelerate the implementation on the high priority activity and provide a clear implementation timeline in the last year of the plan. In addition, Thailand co-sponsored the draft resolution strengthening local production of medicine and other health technologies to improve access. We thank Ethiopia and African group for their initiation. Secondly, we realized that even in COVID-19 pandemic, falsified vaccine could easily be found on various internet platforms. Internet sale has badly exacerbated the unregulated online market on unlicensed medicines. Additionally, various dubious medical claims are advertised, and substandard and falsified medical products are distributed illegally by the internet. Combating the significant problem requires effective international collaboration. We strongly require the Secretariat to immediately develop a working plan to effectively and timely tackle substandard and falsified medical products on internet sale. Finally, we support the implementation and development of the international classification, coding, and nomenclature of medical devices. Taking into account that existing code that many countries have applied differently, we request the Secretariat to provide technical support for a smooth transition at a country level. Thank you, Chair.
Thank you, Thailand. I now give the floor to Belgium, to be followed by Ecuador.
Yes, thank you, moderator. Madam Chair, Belgium fully aligns itself to the statement made by Portugal on behalf of the European Union and its member states. We also fully support the joint statement made by Costa Rica on CTAP. Belgium believes that it is of paramount importance, now more than ever, to achieve equitable and global access to health products. Especially with regard to COVID-19 vaccines, we want to stress that we need to collectively ensure global immunization as quickly as possible. For this, we need to ramp up the production of vaccines, improve the global distribution of the vaccines, and ensure the smooth functioning of global supply chains. Increasing the local production of vaccines is an essential step to this end. Belgium therefore fully supports the principles behind the solidarity call to action, and this from the very beginning. The voluntary pooling of knowledge, intellectual property, data, and technologies is, in our view, the right way forward. We also fully support the CTAP initiative, and we call on all stakeholders, including governments, research institutions, and private companies, to join this initiative. We call on the WHO to ensure operational synergies between CTAP and the COVAX initiative, and especially the COVAX supply chain and manufacturing task force. We also expect this task force to contribute to the realization of more equitable global access to health products in line with the solidarity call to action. Belgium also believes that the future pandemic treaty should contain provisions to ensure more equitable global access to health products. To improve global access to COVID-19 vaccines in the short term, Belgium will donate 4 million doses of COVID-19 vaccines to COVAX in 2021. In the longer run, Belgium will support the local production of health products, in particular in Africa, as part of Team Europe. To conclude, Madam Chair, we fully support the proposed draft resolution on local production capacities. Thank you.
Thank you, Belgium. I now give the floor to Ecuador, to be followed by the International Federation of Pharmaceutical Manufacturers and Associations and the constituency members.
Thank you, Chair. I would like to give the following statement. We welcome the presentation made by the Secretariat, particularly with regard to the review of recommendations for the framework and global plan of action. We also welcome the information provided on transparency and health products. We'd also like to thank the Secretariat for the information provided on promoting monitoring and transparency in terms of the prices of medicines, and particularly in value chains. we call for ongoing debate on these topics since not enough debate has been carried out yet. The updated 2020-2022 plan of action needs to be updated, and we would like to call for review of these matters after 2022. In that framework, we believe it's important to urge governments to comply with the recommendations of the 2022 programme, and we underline the importance of research and development and intellectual property to promote innovation in the field of public health and improve supply and access. The recommendations continue to be extremely relevant, particularly in the context of the COVID-19 pandemic, which has shown the increasing importance of promoting access to medicines. This has also shown the need to increase the production of medicines and vaccines, as well as technology and information transfer and sharing, particularly through the CTAP. We support the statement of Costa Rica, and we also support the draft resolution on strengthening local production of medicines and other health technologies to improve access. We call on other members to support the promotion of local production of medicines. Thank you very much.
Thank you, Ecuador. I now give the floor to the International Federation of Pharmaceutical Manufacturers and Associations and the constituency members, to be followed by India. This third constituency of non-state actors, presented by the International Federation of Pharmaceutical Manufacturers and Associations, is joined by constituency member Global Self-Care Federation. Welcome.
Thank you, Chair. IFPMA and GSBF, reported by ICBA, welcome the WHA resolution on strengthening local production of medicines and other health technologies to improve access. A resilient, sustainable, and high-quality private sector in the health and life science industry is critical for the development, manufacturing, supply, distribution, and availability of medicines and other health technologies, such as vaccines, medical devices, and diagnostics. The creation of appropriate innovative economic and regulatory ecosystems are critical for the development and sustainability of the health and life science industries at national, regional, and global levels. Governments can create an attractive environment for health industries by implementing a series of holistic policies. These include sustainable financing mechanisms and models with access to low-interest capital, creation of a stable business environment that respects business ethics and incentivizes innovation, including through intellectual property protection and enforcement, growing and reliable local markets for healthcare products, facilitating voluntary and mutually agreed upon technology transfer and joint ventures, regulatory system strengthening and reliance practices, policies and legislation to combat falsified and substandard medical products, support and enforcement of GMP standards, free trade and elimination of non-trade barriers, and appropriate incentives to encourage local, regional, and international private sector investments. Critically important is the development and retention of local skilled workforces in science, medicine, pharmacy, technology, digital health, production engineering, business, and regulatory affairs. We note that many of these policy needs are proposed in the resolution, but it is essential that there is political leadership to implement such policies. Member state commitments to long-term investment in health and concrete progress towards UHC as part of an effort to increase people's access to high-quality care is also important to support local production investment. Poor quality care is now a bigger barrier to reducing mortality than insufficient access to healthcare. This is why commitment to UHC must also mean commitment to implement policies and legislation aimed at reducing the burden of substandard and falsified medical products. As part of achieving these objectives, it is essential that WHO and member states maintain open and inclusive dialogue with the private sector. Only together, through the co-creation of solutions and holistic policies, can we meet the common objective of increasing access. Thank you.
Thank you to the International Federation of Pharmaceutical Manufacturers and Associations and their constituency member. I now give the floor to India, to be followed by Kenya.
Thank you, Chair. the challenges imposed by COVID-19 have given rise to a need to prioritize research and development, boost innovative thinking, and improve research capacity with added emphasis on the needs of developing nations. It is also integral to ensure that vaccine, medicine, therapeutics, and diagnostics are distributed more equitably if we want to tackle COVID-19 in a more holistic and inclusive manner. In this regard, there needs to be a higher burden of responsibility on part of developed nations with respect to aiding developing and resource-constrained countries. It is important to ensure free, affordable, and equitable access to all tools for combating COVID-19 pandemic, and therefore there is a critical need to build a framework for their allocation. India believes that technology transfer and voluntary licensing can together catalyze the global vaccination efforts, and in absence of agreement on voluntary licensing, the TRIPS waiver should come into effect immediately, as this would go a long way in effective international and national response to COVID-19 pandemic. We should also work to develop a global framework or specialized protocol for benefit sharing for non-influenza pandemics on the lines of PIP framework consistent with the objective of CBD and its Nagoya Protocol. Chair, India recognizes the significance of substandard and falsified medical products and supports the member state mechanism for control of substandard or unauthorized and unregulated drugs. But while acknowledging the progress made by MSM, India is against any misuse of the mechanism which acts as a barrier to international movement or availability of authorized, quality, efficacious, and affordable generic drug due to wrong interpretation or definition of substandard and falsified drug beyond the purview of national regulations. India also expects MSM to ensure the availability of affordable and quality generic medical product and trust it to not create any document or system which can act as a hindrance. Chair, India acknowledges the need for standardized nomenclature of medical devices, as it will serve as a common language for recording and reporting medical devices across the whole health system at all levels of healthcare for a whole range of uses. Standardized classification would support patient safety, allow comparison and measurement of the availability of medical devices, as well as assessment of access to devices the community using health facility assessment tools. It is also essential for defining and naming innovative technologies, classifying the devices for regulatory approval, and for streaming procurement of these products. Thank you, Chair.
Thank you, India. I now give the floor to Kenya, to be followed by Brazil.
Thank you, Chair. Kenya aligns her statement with that delivered by Ethiopia on behalf of the African member states. Whilst recognizing the linkage between public health, innovation, and intellectual property, Kenya reiterates her support for the proposal at the WTO calling for temporary waiver of intellectual property rights, COVID-19 tools. Many low and middle income countries, Kenya included, are now being confronted with an acute shortage of COVID-19 vaccines under the COVAX facility. This scenario is contrary to public health goals as it erodes public trust, breeds vaccine hesitancy, and prolongs the acute phase of the pandemic. We therefore urge member states to support all efforts to increase availability and equitable distribution of vaccines across the world. We also request the DG to prioritize implementation of the global strategy and plan of action on public health, innovation, and intellectual property, which will ensure that more member states have the required capacity to innovate and develop solutions to emerging health challenges. Regarding substandard and falsified medical products, Kenya is engaged in the discussion of the member state mechanism in her capacity as vice chair of the steering committee on behalf of the Afro region. To implement the mechanism's list of prioritized activity, Kenya has now adopted risk-based post-market surveillance through a national technical working group on pharmacovigilance and post-market surveillance, as well as leveraging on technology to fight SF medical products using a pharmacovigilance e-reporting platform. We are committed towards establishing a track and trace platform as a strategy for prevention and detection of and response to substandard and falsified medical products. Turning to the standardization of medical device nomenclature, Madam Chairperson, Kenya recognizes the value in establishing a nomenclature system for medical devices in support of efforts to strengthen the assessment, regulation and management of, and access to medical devices through the entire health ecosystem. We have therefore adopted both the global medical device nomenclature and the universal medical device nomenclature systems within our regulatory systems. We, however, note and share the concerns contained in the DG's report regarding the limited accessibility to information experienced by our stakeholders when using the existing systems. We therefore welcome efforts by WHO to develop a nomenclature system that is open and accessible to all. In line with the EB recommendation, we urge the Secretariat to continue discussions with key stakeholders on this process and keep Member States updated on further development. In conclusion, Madam Chair, Kenya supports the adoption of the resolution proposed by Ethiopia on local production, of which we are proud co-sponsors. I thank you.
Thank you, Kenya. I now give the floor to Brazil, to be followed by the International Pharmaceutical Students Federation and the constituency members.
Thank you, Mr. Chair. Brazil has been actively engaged in the implementation of the global strategy on public health innovation and intellectual property, leading debates on the topic at the WHO. Together with other interested developing countries, we were able to approve Resolution WHA 68.18 to extend the validity of the global strategy until 2022. Since we have engaged with other member states to propose several other decisions on the matter, mainly aiming at promoting the implementation of the plan of action with special focus on the recommendations as put forth by the review panel. It is time to reflect on possible extension of the validity of the GSPA. Among these actions, we have been emphasizing the importance of implementing the global strategy and the action plan, as well as the need to increase the transparency of drug prices and actions to prevent shortages. Brazil already develops and implements most of the suggested actions, with emphasis on those related to research and development, building innovative capacity in health products, and technology transfer that meet national needs. Many of these actions are essential for maintaining Brazil's unified health system. The promotion of measures to tackle barriers to access is of great interest to Brazil, as they have a direct impact on government procurement of health products. These actions, hence, are of crucial relevance to the sustainability of our health system. Our country remains engaged and active in several debates at the WHO and other multilateral forums on access to medicines in the context of challenges to ensure universal health coverage. In this regard, Brazil is honored to co-sponsor the resolution on local production proposed by Ethiopia, which creates an enabling environment to increase and diversify production of health products. Brazil's regulatory agency, Anvisa, is closely involved in the discussions about substandard and falsified medicines. It maintains a post-market surveillance system for health products, in addition to providing a space for voluntary notification service on adverse events involving medicines, vaccines, and diagnostic tests. It also inspects and monitors pharmaceutical companies and drugstores to ensure that no substandard or falsified products are marketed to the general public. A list of products unsuitable for human use is also made available to the public through the Anvisa website and is updated frequently. Brazil also reiterated its comments made during the last executive board that the development of a new system for the standardization of nomenclature of medical products merits more reflection so as to avoid duplication with existing systems. Thank you so much, Mr. Chair.
Thank you, Brazil. I now give the floor to the International Pharmaceutical Students Federation and the constituency members, to be followed by Japan. This final constituency of non-state actors, presented by the International Pharmaceutical Students Federation, is joined by members Medicine for Malaria Venture, World Heart Federation, International Alliance of Patients Organizations, International Pharmaceutical Federation, and the International Council of Nurses. Welcome.
Thank you. IPSF, on behalf of the constituency group supported by the Fight the Fakes Alliance, thank you for the opportunity to make this statement. The COVID-19 pandemic has led to a global surge in reported falsified medical products, including personal protective equipment, diagnostic tests, and more recently, fake treatments, cures, and vaccines. IPSF, on behalf of the constituency group supported by the Fight the Fakes Alliance, is calling on the global health community to raise awareness about the dangers of substandard and falsified medical products during this particularly challenging time for global health. Law enforcement is working to prevent and crack down on criminal networks seeking to profit from producing, distributing, or selling falsified medical products during this pandemic. Effective action requires strong legislative frameworks that address this threat holistically, including the danger of illegal online pharmacies. On behalf of the constituency, we encourage member states to join and ratify the Medicrime Convention, a unique international tool to deter those engaging in schemes aimed at deceiving patients by criminalizing such activities, ensuring national and international cooperation and protecting public health. Manufacturers, distributors, governments, healthcare professionals, and all those involved in delivering COVID-19 vaccines to the population are working together to ensure these vaccines are safely procured, stored, distributed, and administered. Processes that allow securing and close monitoring of the chain of distribution of COVID-19 vaccines are being put in place by all stakeholders involved to ensure every vaccine administered through the legitimate supply chain is genuine, of high quality, safe, and efficacious. In this regard, the constituency and its members welcome the publication of WHO's policy paper on traceability of medical products, which highlights the importance of implementing GS1 global standards for identification, barcoding, and data exchange as an important component in ensuring a safe distribution and administration of medical products. The constituency and its members stand ready to support WHO and member states in tackling this issue through increased awareness raising, political engagement, and health system strengthening initiatives. Thank you.
Thank you to the International Pharmaceutical Students Federation and the constituency members. I now give the floor to Japan, to be followed by Bangladesh.
Thank you, moderator. Japan welcomes the report in these agenda items, and we are pleased to co-sponsor the resolution strengthening local production of medicines and other health technology to improve access. The world is facing an unprecedented situation due to COVID-19 pandemic. Japan recognizes the importance of expanding vaccine production, ensuring equitable access to vaccine with guaranteed safety, efficacy, and quality, including in developing countries, and accelerating vaccination in every country to bring COVID-19 pandemic under control. Collaboration among various stakeholders, such as Gavi and CEPI, is needed more than ever before. This is also true for other diseases, not only COVID-19. Tuberculosis is also one of the critical diseases, and the Stop TB partnership has played a critical role in improving access to TB diagnosis and treatment. Global health innovation can be achieved through collaboration with organizations like these. And furthermore, regional regulatory harmonization and human resource development that can support innovation are of paramount importance. In order to improve access to vaccine in developing countries, it is essential to improve local delivery methods such as vehicle with refrigerator for the last mile. For that purpose, vaccine refrigerator car obtained a WHO pre-qualification for the first time in the world this year. We need to find solutions for delivery issue as well to improve access through innovative approach. Moreover, Japan has been a keen supporter of UHC and contributing to international multilateral cooperation for COVID-19 response, such as ACT Accelerator and COVAX Facility. Japan will co-host COVAX Vaccine Summit on June 2nd to secure the extra pledge for COVAX Facility. In addition, given the importance of rapid and large-scale production of affordable COVID-19 treatments in low and middle-income countries, we support Medicine Patent Pool through our financial contribution to UNITAID to promote voluntary licensing of intellectual property. We will continue our best endeavor to improve access to vaccine, therapeutics, diagnostics, and other health technology, collaborating with international community. I thank you.
Thank you, Japan. I now give the floor to Bangladesh, to be followed by Paraguay.
Thank you, moderator. Madam Chair, we take note of the report. The COVID-19 has again proved the importance, value, and relevance of the innovation of and timely, affordable, and equitable access to medicines, vaccines, and diagnostics. So, addressing the persisting challenges in the implementation of the GSPA-PHI is essential. In this respect, my delegation would like to make a few points. First, we understand that the lack of funding is the key impediment in the implementation of GSPA-PHI. WHO needs to make efforts to secure sustainable financing to ensure that GSPA-PHI can be an effective tool for innovation and access to medicines and other medical technologies. Second, fair and equitable access to health products should be a global priority. The international response to the pandemic has also brought innovative ways into play, such as the ACT Accelerator, the COVAX facility, and the CTAP. However, these initiatives have not yet been effectively operational. We would like to see the full and effective operationalization of these initiatives through concerted global efforts based on solidarity and inclusiveness. Third, the TRIPS flexibilities should be used to ensure that intellectual property rules do not hamper the development of local production capacity and the building of technological capacities. It also remains crucial that developed countries provide incentive measures to their enterprises to transfer technology to the least developed countries for addressing the public health needs as per Article 66.2 of the TRIPS agreement. And fourth, WHO must continue to make efforts for scaling up the production of vaccines, therapeutics, diagnostics, and other medical equipment through compulsory or voluntary licensing to help the pharmaceutical industries across the world to get licenses, technologies, and technical know-how to produce these items. IPR should not come in the way of taking measures to protect public health. Madam Chair, in connection to item 13.7, we underscored the global standardization of medical devices nomenclature system that should be based on scientific findings and international standard. In addition, global standardization must consider the diverse regulatory systems and manufacturing conditions in all member states so that it can be applied globally. I thank you, Chair.
Thank you, Bangladesh. I now give the floor to Paraguay. This will be the last intervention before we pass the floor back to the esteemed chair. Paraguay, the floor is yours.
Thank you, moderator. Chair, Paraguay takes note of the report on the Global Strategy and Action Plan on Public Health, Innovation and Intellectual Property. And we would like to thank Ethiopia for its leadership during the negotiations on the draft resolution on strengthening local production of medicines and other health technologies to improve access. We believe that access to health technology and products which are required to tackle the pandemic must be treated as a priority by the international community. For that reason, since last year, Paraguay has supported the Solidarity Call to Action, which seeks the voluntary sharing of knowledge, intellectual property, and the necessary information to develop tools to tackle COVID-19. Increasing local production will help to improve access to high-quality, safe, and efficacious medicines and other health technologies. Furthermore, including local production as part of general strengthening of health systems will help to promote sustainable access as well as tackling any scarcity of medical products. My country considers the draft resolution as an incentive to increase technology transfer and promote international cooperation and solidarity. Therefore, Paraguay has decided to co-sponsor the draft resolution, and we urge other member states to support it. Thank you.
Thank you, Paraguay. Thank you, member states, and thank you, esteemed chair. I now pass the floor back to you.
Thank you very much. Delegates, we have again achieved good progress. It is now time to close the meeting, so we will suspend the discussion of Agenda Item 13, review of and update on matters considered by the Executive Board, sub-items 13.4, 13.6, and 13.7. I would like to invite the moderator to please read the list of member states still wishing to take the floor, as they will need to raise the hand again when we reopen these items.
Thank you, Chair. The United Republic of Tanzania, Lebanon, Spain, Canada, Austria, Vietnam, Indonesia, the United Kingdom of Great Britain and Northern Ireland, Colombia, the plurinational state of Bolivia, Malaysia, Egypt, Cuba, Sudan, Ghana.
Thank you. I propose then, when we resume tomorrow, we complete our consideration of this grouping of agenda items. Please refer to the daily journal to full details. The meeting is now closed.